Okay, Chair.
Okay, good afternoon to our 2 p.m. this February 17th, 2021 of the Consumer Protection and Commerce Committee. This is our last big agenda before tomorrow's sort of cleanup with 4 bills. My thanks to everyone waiting in the queue to testify. We have a lot of important measures to consider today. Beginning with a few housekeeping notes. For those testifiers who are new to this committee, we do impose a 2-minute time limit. So after the expiration of your 2 minutes, I will ask you to start to summarize. That way we ensure we can get through all of these measures in timely fashion as we are approaching the first lateral filing deadline tomorrow, which is one of our internal timelines that we must abide by. I'd ask for people to observe decorum and practice aloha as they are testifying. I would also like to note, if you can please keep your mics muted unless you are testifying. That will also help our members be able to concentrate on the testimony at hand. I will call you, and when you're recognized is the time to unmute yourself and commence with your testimony. With that, we'll take on our first agenda item, HB 137, relating to liquor. This provides that violations of the liquor tax law shall be referred to the Director of Taxation for investigation. It repeals the general right of inspection without a warrant of potential violations of liquor tax law. It also repeals the discretionary power of the Liquor Commission to deny a license. It requires applications for liquor licenses to be notarized, and it provides the administrator of the Liquor Commission discretion over whether to refer applications for investigation, and making some additional adjustments to the law as well. First off, we have the Department of Taxation, Director Choi.
Good afternoon, Chair Jacob Hurlitz on behalf of the Department of Taxation. I will stand on our written testimony offering comments. Thank you.
Thank you. We also have the Honolulu Liquor Commission, Don Picaro Jr.
Aloha, Chair Johansson and Vice Chair Kitagawa, Don Picaro from the Honolulu Liquor Commission. With respect to the, we support the bill that has been presented. And just for a clarification, there are a number of things that require, I guess, explanation. So with respect for section 1, we're requesting that the part about the tax law 244D, it's all investigations are be referred to the tax department. And the reason being, our investigators are not, qualified or to investigate tax violations or have a forensic or accounting background to do that. And so that's why we want that in that, because with that in there, we have found that some of our investigators have been asking individual licensee or applicants for their tax returns. And that's not what we're in the business of doing. I mean, and the folks from the tax department can correct me if I'm wrong. I mean, to get someone's tax returns in front of their body, it has to be by subpoena. Now, under the statute as it exists, we can gain all records without a warrant. And yeah, we want that to still remain in the statute. It will remain in the statute. All we're asking is to delete 244D. Because if you have 244D, that gives an investigator enormous power. They can say, hey, you know what, we want your tax returns. And you can't get someone's tax returns unless you get a subpoena, come before the tax commission, or you get a search warrant or a court order. That's my understanding. So and this only goes for applications. So that's what, by removing 244D, you're removing that power from an investigator for asking for that, which is not really relevant to an application. Okay, the next part, the general right of inspection. That's we want that still in. But all we're saying is 244D. Because under 244D3, we have to cooperate with the tax department. And we've if we believe something's wrong, we let them know. If they want records from us, 244D3 says we have to cooperate them with the state tax department and give them the records. And we have done with the IRS and the state tax department.
I'm sorry to interrupt, Mr. Picaro, but
Sure.
if you could start to summarize, please.
Okay. So, what we have here, all of these things that we're requesting, a lot of it, the laws have changed, it's archaic, so that's what we're trying to do, make it more business friendly, because we can get without, by removing some of these things, you will free up our investigators. It's ludicrous for people to apply for a liquor license and we have to tell them it takes 3 to 6 months before you get a liquor license. And removing some of these things will help us to be more customer service. And myself, and I have my chief investigator, he's online as well. If you have any questions, we're ready and willing and able to answer any questions that you have for us. Thank you.
Thank you. We also have Peter Nakagawa with the Honolulu Liquor Commission in support. Peter, did you want to say something?
Yeah, good afternoon, Chair, Vice Chair. Thank you for this opportunity. I stand on my written comments, and I'm here just to answer any questions that the committee may have in regards to this matter.
Okay, thank you. Next, we have the Tax Foundation of Hawaii, Tom Yamachika.
Thank you, Chair and members. Tom Yamachika from the Tax Foundation. I will stand on my written testimony. I just wanted to add that if the real problem here is Liquor Commission investigators asking for tax returns, and we don't want them to do that, I think there is a simpler solution than the sledgehammer approach being embodied in this bill. I think a more surgical solution could be, crafted, if, as the Liquor Commission is saying, they want to, keep the cooperation, keep the exchange of information provisions. I'd be happy to answer any questions.
Thank you. Members, please note that's all the testimony we have submitted on this measure. Everyone was here and present to testify. We'll transition to our legislative member question and answer period for any of the testifiers if they so wish. Members, any questions on HB 137? Representative Mizuno.
Thank you, Chair.
You might want to turn off your volume, Representative Mizuno, from your computer.
Thank you. My question is to the administrator, Don Picaro. The question I have, Mr. Picaro, is the concerns with tax and the investigators looking in the tax records. If I'm hearing you correctly, you're saying that this should be left to the Department of Taxation and not your investigators. Is that correct?
That's correct. We don't, by leaving that 244D in, you're asking our investigators to investigate tax. We don't tax fraud. We don't do that. You get people going off on tangents and not doing what they're supposed to do by leaving that something that in that doesn't apply to us. Whatever records that we have, and let me give you an example. We've been requested to give documents, okay? Now, if someone is not reporting the accurate gross liquor sales, because that's what they have to do, because when you report gross liquor sales to us, we have a right to audit them, and we have a right to ask them for their records. And that's your sales, and we also can get records from the wholesalers, because if somebody underreports the liquor sales, our auditors can tell by just looking at getting records from the wholesalers, because we ask the wholesalers, give us your records. When we look at because a retailer has to buy from a wholesaler. There's a 3-tier system. When you buy from the wholesaler, you buy a bottle of vodka. They can tell you how many shots of vodka you can pour from that. So from looking at that, they can tell you how much what these people charge for their drinks, how much they made, and how much they didn't make. Now, if they're saying they made, say 100,000, and we look at the wholesale records, they say, wait a minute, they bought more liquor than what they're reporting. So then we can tell there's a discrepancy. Then we say, give us all your records, and we look at it. Now, if there's anything improper, they're not paying their things, we can report that to the tax office. If the tax department says they question someone's accurate reporting, once we turn over our records, they can see what we have, and then from there they can glean if these people aren't paying their tax.
So,
Because
Mr.
if they're not
Picaro,
reporting accurately, then they're not going to be paying the tax correctly.
if I could interject, Mr. Picaro, your concerns are with tax fraud, and it should be with the Department of Taxation, not with your investigators. Is that correct?
Correct.
Okay, last question. And Administrator Picaro, I don't know if it's best for you to answer this or your chief investigator. Could you explain the concern with fit and proper? This is based on your investigator's assessment and their opinion. Your concern with that?
With the fit and proper, let me say, and then I'll turn it over to Peter. Just one thing, the way it's written in the summary, we aren't. Wait, let me get my glasses. When you get over 60, you need to. We are not removing the discretionary power of the Liquor Commission to deny a license. We're removing the part that says fit and proper, because it's so broad that it could mean anything. It's too subjective. There are already measures within the statute, disqualifiers, that all the investigator has to do is report factually, not give an opinion. It allows them to give an opinion, a legal opinion, by looking at the law, which they are not lawyers. And that's why that fit and proper should be removed, because there is no definition for fit and proper. And a person can say, well, I don't think it's fit and proper. For what? Because they got into an argument with this person for whatever reason. But Peter, my chief investigator, can give you more information on that.
Hi, sir. Just to add on to what Administrator Picaro said, basically, there is no real definition for fit and proper. It's left to the imagination of the investigator. It's extremely ambiguous, very overbroad, and not defined at all within statute. And as the administrator had said, there is a significant amount of disqualifiers that are objective in nature, not subjective in nature. So we want to remove all subjectivity, any overbroad, ambiguous language, and just keep things focused and objective based on fact.
Thank you very much. Thank you, Mr. Chair.
Thank you, Representative. Members, any other questions on HB 137?
Just one.
Representative
Chair.
Morikawa.
For the Department of Tax, your testimony says that you think that there should be amendments to Chapter 244D, but it doesn't say what kind.
There's a few provisions that kind of echo what are in the bill, that are the same authority exists in Chapter 244D. So if the bill wants to remove that particular authority, it would need to remove the sister provisions that are in 244D. I don't have them off the top of my head, but there's in one or two sections, the same language is in there.
Okay, thank you.
Thank you, Representative. Members, any other questions? Okay, seeing none, we'll move on to our next agenda item. Thank you. HB 592 relating to utilities requires, this bill would require the Public Utilities Commission to explore through its docket process solutions to the problems posed by siting of above ground electrical infrastructure in high-risk areas such as Maui. It requires a submission of a report to the legislature as well. We have our first testifier indicating that they will be present. Do we have Dean Nishino from the Division of Consumer Advocacy, DCCA? Not here. Commissioner Griffin from the Hawaii Public Utilities Commission.
Good afternoon, Chair, Vice Chair, committee members. My name is David Parsons. I'm here on behalf of Jay Griffin, Chair of the PUC. We'll stand on our written testimony, offering comments and available for questions. Thank you.
Thank you. Members, that's all the testimony we have on this particular measure. Any questions for the Public Utilities Commission members? Okay, seeing none, then we'll move on to our next agenda item, HB 102, relating to sunscreens, and this would ban avobenzone and octocrylene, and follow up on the progress made of our oxybenzone and oxynoctate bans. The ban would be effective starting January 2023. We have the Department of Health offering comments.
Good afternoon, Chair. Diana Felton, toxicologist with the Department of Health. We stand in our written testimony and are available for questions.
Thank you. We also have DLNR.
Aloha, Chair, members of the committee. I'm Brian Nielsen, Administrator, Division of Aquatic Resources. We stand on our written testimony and support available for questions. Thank you.
Thank you. We also have the Hawaii Food Industry Association, Lauren Zerbel, in opposition.
Thank you, Chair. We'll stand on our testimony in opposition.
Thank you. Do we have Caitlin Jacobs from the Surfrider Foundation Oahu chapter with us? No, not yet. Next, we have Lynn Miyahiro with Public Access to Sunscreens, the PASS Coalition, in opposition.
Hi, thank you, Chair Johansson and Vice Chair Kitagawa. I'm here representing the Public Access to Sunscreen Coalition. We oppose HB 102 because it will create additional barriers for people to access sunscreen that is safe, effective, and FDA approved. We know that sunscreens are an important tool for skin cancer prevention, and this bill would eliminate approximately 64% of what's currently on the market. The science behind the purported link is being called into question between the link between sunscreen ingredients and coral damage. We do know that the major reasons of coral damage are climate change, water, land-based pollution, water runoff, and other environmental major causes of damage to our coral reefs, especially here in Hawaii. This is important to note that there are now studies that contradict earlier research that have been widely used to support the sunscreen ban. For example, Dr. Karis Mitchell-Moore talked about finding out that the actual levels of oxybenzone sampled here in Hawaiian waters was about 141 times more than previously stated and 1,000 times lower considered to be toxic to coral. So there's a lot of conflicting information out there about sunscreens. And so Congress has ordered the National Academy of Sciences, our preeminent scientific body here in the US, to review all the data and evaluate the scientific merit of all these different studies. And this study is expected to be completed in 2022. So we ask that the legislature hold on HB 102 or any other measures about sunscreen ingredients until this study is completed. I also want to note that the FDA has made it very clear that they still strongly advise continued use of sunscreen. And I'm going to read from their actual website that says when they're seeking more information about the absorption levels of certain sunscreen ingredients, including the ones in HB 102. However, absorption does not equal risk, and the findings in these studies do not mean that the FDA has concluded that any of the ingredients tested are unsafe for use in sunscreen, nor does the FDA seeking further information indicate such. And they go on to talk about how they are looking for more information, but given the recognized public health benefits of sunscreen use, the FDA still strongly advises all Americans to continue to use sunscreen in conjunction with other sun protective measures like hats, clothes, sunscreen, and other things. So again, we ask that the legislature hold on HB 102 or any other legislation until there is more peer-reviewed scientific data. Thank you for this opportunity to testify, and will be available.
Thank you. We also have Lisa Bishop with Friends of Hanauma Bay in support. Lisa Bishop with Friends of Hanauma Bay.
Nope. I'm on mute now. Can you hear me now, Chair?
Yes, we can hear you.
Thank you.
About Thank you.
That's all right. Aloha, Chair Johansson, Vice Chair Kitagawa, and committee members. I am Lisa Bishop, representing Friends of Hanauma Bay, 38 other Hawaii coral reef stakeholder organizations and businesses, and eminent scientists from around the world, including the Sorbonne, Shandong University in China, Ben Gurion University and Tel Aviv University in Israel, the University of Tehran, Chemists Without Borders, Canadian, US, and UK board certified doctors, the College of Charleston, South Carolina, and the Hereticus Environmental Laboratory in Virginia. We support HB 102 and urge you to amend the language back to an effective date of January 2023. And if I may counter the testimony of the previous testifier, the FDA in February of 2019, when they issued an update to the sunscreen monograph, at least their plans to update the sunscreen monograph, they determined and publicly announced that only zinc oxide and titanium dioxide, the mineral sunscreens, have been demonstrated to the FDA's satisfaction to be generally recognized as safe and effective. Octocrylene and avobenzone are not mineral sunscreens, and so we continue to press that they be taken off the market in Hawaii. Thank you for the opportunity to support HB 102 with the amendment.
Thank you very much. We also have Ted Boland in support with the Hawaii Reef and Ocean Coalition.
Thank you, Chair Johansson, Vice Chair Kitagawa, and members of the committee. The Hawaii Reef and Ocean Coalition is strongly in favor of this legislation. I want to highlight the fact, raised somewhat by Ms. Bishop as well, that the sunscreens that are chemical, petrochemical, as opposed to mineral, are of, in my mind, dubious safety, because the way people actually wear them and apply them is not sufficient to protect. So there is something called sunscreen abuse, where people get a false sense of security that they are protected from the sun and therefore stay out longer in the sun. I agree that skin cancer is a real thing, and people should stay out of the sun in the middle of the day. And if they're in the sun, they should wear clothing and hats to protect them. And if they are in a place where they want to not wear those clothes, like the beach, they should wear a mineral sunscreen well applied to protect themselves. But to jeopardize the reefs on which Hawaii's economy and recreational lifestyle and shoreline all depend, so that people can wear sunscreens that wash off easily and kill the reefs, seems like bad public policy to me. Under the precautionary principle, we should protect our reefs and we should ban these two chemicals. There are other chemicals that are on the market. There are other mineral sunscreens on the market. No one needs to be without sunscreen. So that is a false argument that is put forth by the industry, and I think the committee should reject that and move this bill forward. Thank you very much.
Thank you very much. We also have Celeste Nip with the Personal Care Products Council in opposition.
Hi, good afternoon, Chair and members of the committee. My name is Celeste Nip, and on behalf of the Personal Care Products Council, we oppose this bill for the reasons we set forth in our testimony. And we'd like to echo that if the past testimony, they said that 60+% of the sunscreens currently available would be taken off the market, which would really limit consumer and confine consumer access to safe and effective sunscreens. So on behalf of the council, PCPC, we're here to answer any questions, and thank you for considering our testimony. Thanks.
Thank you. Let's see, not here. We also have individual testimony and support proffered by Christopher Hendrickson.
Greetings, and thank you for the opportunity to submit testimony on this. I stand by my written testimony in strong support of HB 102 and recommend that the effective date be amended back to January 1st, 2023. It was a little confusing seeing the 2050 effective date. So if we could clear up any about that, that'd be helpful. So strong support. Thank you.
Thank you very much, Christopher. Members, please note that's the extent of our present testifiers who have indicated that they'll be testifying on HB 102. But please note there's numerous testimonies, both organizational and individual, in support and opposition on this measure. With that, we'll move to questions. Members, any questions on HB 102? Okay, seeing no questions, then we'll move on to
Mr.
HB.
Chairman, I'm sorry, I was having a problem. I was having an audio problem.
Sorry, Representative Har, please proceed.
Mr. Chairman, gosh, I really don't know who to ask this question to. It's going to be either Lynn Miyahara. Lynn, can I have you?
Hi, Rep. Har? Yes.
Lynn, thank you so much for your testimony, both your verbal and your written testimony. One of the things, I've studied this issue, and to be very clear, sunscreen is my life. And I have studied this issue. I'm intimately familiar with the difference between chemical and mineral sunscreens. One of the things that all of the opponents have seemed to have missed is the cost factor. Are you aware of the difference in cost between chemical and mineral sunscreens?
Right now, there is, as it stands, zinc, there is a lot of different ranges, I think is what's fair to say. From personal experience, the mineral sunscreens tend to be a bit more expensive, but it really depends on where you're looking, right?
Okay, well, I've looked at studies and they're anywhere between 2 and 16 times more expensive. Mineral sunscreens are much more expensive. So I would subscribe that many local people who want to have access to sunscreen and are unable to afford it, why should they be denied that access to a sunscreen because the mineral one is more expensive? And I've looked at studies, I have to find my research on it, but there are studies that confirm mineral sunscreens are in fact much more expensive. And that's something that you guys, all of you guys in opposition, including you, Ms. Nip, that's something I want you guys to all make sure that you're incorporating that into your testimony for the future. Thank you, Mr. Chairman.
Appreciate that. Thank you.
Representative Har. Oh, I'm sorry, excuse me, Ms. Mihira, were you saying something?
Okay. Just saying thank you.
Okay. Members, any additional questions on HB 102? Okay, seeing none, then we'll move on to our next agenda item, HB 214. This is relating to emergency medical services. This allows emergency medical personnel who successfully complete National Registry of Emergency Medical Technicians certification to be qualified to perform emergency medical services as emergency medical technicians, EMTs. First with DCCA's Hawaii Medical Board, Doreen Eddy with comments.
Good afternoon, Chair Johansson and committee members. Doreen Eddy, appearing on behalf of Lani Koki, who is the Executive Officer for the Hawaii Medical Board. You have our submitted comments.
Thank you. We also have Gary Lum with the State Fire Council and Honolulu Fire Department in support.
Good afternoon, Chair and committee members. Gary Lum, representing the State Fire Council, which is made up of the 4 county fire chiefs. We stand on a written testimony in strong support of this bill and available for questions.
Thank you. We also have Speedy Bailey with the American Medical Response, AMR, company in opposition.
Yeah, good afternoon, Chair. Speedy Bailey, I'm the Regional Director with American Medical Response. We provide ambulance service throughout the state of Hawaii. We oppose this bill, basically feel that it deregulates EMS in Hawaii. We've had a standard of EMS that is higher than the National Registry training for the 40 years and 45 plus years that our system has been in place. And we think this deregulation would confuse not only the industry stakeholders, but also the public itself, because all EMTs are not created equally. And the standards that we have upheld have made a difference. With all due respect to our partners in EMS, firefighters, ocean safety personnel, they are essential to the system, and we do support the need for recognition of that fact, and would respectfully suggest that there are bridge courses and many thousands of firefighters that have trained as a state licensed EMT and continue to work in our system And we recognize them as vital partners in our EMS system. The system works. There haven't been any problems with it. If you change one piece of it, you're going to have to change a number of other things. And I think this issue, actually, it's not a new issue. It's been on the table for like the last 40 years. And we respectfully would suggest that we as a system look at not changing one piece, but looking at all the changes that could be going forward vis-a-vis this issue. So thank you very, very much for this opportunity to testify.
Thank you very much. Members, please note that's the extent of the testifiers indicating that they be present at today's virtual hearing. We also have testimony individually and from organizations providing comments, support, and opposition to this measure. With that, members, any questions on HB 214? Okay, seeing no questions, then we'll move on to HB 227. This is relating to health. This clarifies that the group of professionals who are prohibited from knowingly referring to or transferring patients to an uncertified or unlicensed care home. It repeals the landlord exclusion, and it requires the Department of Health to prioritize complaint allegations based on the severity for inspections of state licensed or state certified care facilities. First off, we have the Department of Health in support.
Good afternoon, Chair Johansson and members of the committee. Keith Ridley on behalf of the Director of Health. We strongly support this measure and the changes that were made in HD1. But I do need to point out that in our testimony, there was an error in some words that were omitted. And if I can refer to you to lines 6 and 11 of page 3 of the bill, we certainly do want to include healthcare and human services, members of healthcare and community services community. But we do respectfully request that the word "and" be replaced with the word "or." So on line 6 and line 11 on page 3, to replace the word "and" with "or." Thank you, and I stand ready for any questions.
Thank you very much. We also have the Department of Human Services offering comments.
Aloha, Chair, Vice Chair, and committee members. On behalf of the department, I'm Daisy Hartsfield. I'm the Social Services Administrator. I would like to note that there were 2 separate submissions in regards to written testimony, both offering comments. I'll stand by the written testimony submitted and be available for any questions. Mahalo.
Thank you. Next, we have Susan Kinapo in support with the APPCA.
Yes, Your Honor.
Hi, Susan. Excuse me.
I support this bill and I stand by my written testimony, Your Honor.
Thank you very much. Members, that's all the testifiers who have indicated that they would be present at today's virtual hearing. Please note that we have numerous organizations and individuals proffering supportive testimony on this measure, HB 227. Members, any questions on HB 227? Okay, seeing none, we'll move on to our next agenda item, HB 485, relating to taxation, and this would increase the amount of rental motor vehicle surcharges from the tax from $5 to an unspecified amount. Okay. First, we have the Department of Transportation.
Thank you, Chair. Thank you, Chair Johansson. David Rodriguez with the Department of Transportation. We stand in our written testimony and support.
Thank you. We also have the Department of Taxation.
Good afternoon, Chair Jacob Hurlitz on behalf of the Department of Taxation. We'll stand on our written comments asking for a January 1, 2022 effective date. Thank you.
Thank you. Let's see, we also have the Tax Foundation of Hawaii offering comments. Tom Yamachika.
Thank you, Chair. Tom Yamachika from the Tax Foundation. We've submitted written comments and we'll stand on those. We'll be happy to answer any questions.
Thank you. We also have Avis Budget Group, Lori Lum in opposition.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, members of the committee. Avis Budget Group is in opposition to this bill. In 2019, the legislature increased the amount of the rental motor vehicle surcharge tax from $3 to $5, and we believe the industry contributes more than its fair share to the state highway fund with this current tax. An increase could lead to an overall decline of transaction days, adding to our financial hardship. Avis Budget Group's operations has suffered a significant revenue loss in 2020 due to the pandemic and is still struggling. We request that the industry be allowed to recover before additional fees and increases are considered. Thank you for the opportunity to testify.
Thank you. We also have Mihoko Ito with Enterprise Holdings in opposition.
Good afternoon, Chair, Vice Chair, and members. Mihoko Ito on behalf of Enterprise Holdings. We largely echo the comments of Avis Budget and would just note that this proposed increase would almost triple the taxes that are charged under the rental car surcharge tax in the last 3 years. And would also note, yesterday I was asked questions about the percentage of local renters that would be impacted by another bill. And I inadvertently said it was 20%. It's actually 15% of vehicles that are rented by local renters. And this tax would hurt them as well. So we'd ask you to hold this measure. Thank you.
Thank you. Members, that's the extent of our testimony on this measure. Members, any questions on HB 485? If no questions, I just have one, Mihoko, based on your testimony. Thank you. That's very helpful to know that it's 15% of locals who also rent rental cars. Do you know, and if not, it's totally okay if maybe you can just get me the information. What is the average duration of a local resident renting a car?
Of a local resident?
Yeah.
I'm not sure about that, but I can certainly ask and we'll get you that information.
Yeah, okay, that would be great. Thank you.
Sure.
Members, any questions on HB 485? Okay, seeing none, thank you very much. We'll move on to our next agenda item, HB 718, relating to health. And this requires DHS to compile information regarding employers having employees who receive public assistance and to submit that report to the legislature on the 50 employers with the highest number of employees receiving public assistance. First, we have the Department of Labor and Industrial Relations offering comments.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, and members of the committee. We stand on our written testimony and are available for any questions. Thank you for letting us testify today.
Thank you. We also have the Department of Human Services offering comments.
Aloha, Chair. This is Gina Moore Peterson speaking on or testifying on behalf of the Department of Human Services. We stand on our written testimony and available for questions. Thank you.
Thank you. Members, that's the extent of present testifiers. Any questions for either of the departments members? Okay, we've seen this measure for several years. Okay, if no questions, then we'll move on to our next agenda item, HB 302. And this is relating to APRNs. It authorizes APRNs to certify whether a person is totally disabled under the income tax code. It also authorizes APRN nurses with a psychiatric specialization to make capacity determinations. And it adds APRNs with psychiatric specializations as primary providers in advanced mental health care directives. Let's see. Do we have Leanne Tashima from DCCA, Board of Nursing, offering comments?
Hello. Can you
Hi.
hear me?
Yes.
Hi. I have to apologize ahead of time in it.
I'm sorry, I think your screen froze, so we didn't hear after you said, can you hear me?
My internet connection.
Ah, okay. I think we can see you moving, so please proceed.
Oh, we have written testimony, so we'll stand on that. But if you have any questions,
Okay, thank you. Offering comments, members. We also have the Department of Taxation offering comments.
Good afternoon, Chair Jacob Hurlitz from the Department of Taxation. We'll stand on our written comments. Thank you.
Thank you. We also have the Hawaii Association of Professional Nurses, Bradley Kuo, in support.
Dear Chair and Vice Chair and committee members, my name is Dr. Bradley Kuo. We stand on our written testimony and we're available for any questions.
Thank you. We also have the Hawaii State Center for Nursing, Laura Reichart, in support.
Good afternoon, Chair, Vice Chair. Thank you for hearing this measure. And in addition to our written testimony in support, I want to emphasize the request to add in the language that would adopt the authority from the CARES Act for APRNs to certify and recertify patients for home health care, which would have particular beneficial impacts for people on our neighbor islands. Aloha, and I'm available for comments.
Thank you. Members, that's the extent of present testifiers on HB 302. Please note that we also have testimony largely offered in support by individuals and organizations with some additional comments and an oppositional testimony from an individual. Members, any questions on HB 302? Vice Chair Kitagawa.
Thank you, Chair. Maybe I'll ask Laura Reinhardt from the Hawaii State Center for Nursing, since Leanne seems to be having some technical issues. Laura, I'm just wondering if you can explain what the educational requirements and training are for APRNs, specifically APRNs with a psychiatric specialization, and do they need to do clinical hours and or residency hours, and how does this differ from physicians or licensed psychologists who are currently included in the law?
Thank you for that question. So all APRNs, or I should start in Hawaii, APRN's scope of practice is in line with the APRN consensus model, which is the national best practices. So APRNs must have an RN license in good standing, and then they complete an accredited education from a school of nursing in their practice area. So for psychiatric APRNs, it must be with that focus on psychiatric care across the lifespan. And then they must graduate in good standing, pass national certification, and only then may they become licensed as an APRN. The APRN education requires, in addition to a nursing license, and that initial nursing education requires didactic and clinical education, or that is education where you are learning how to take care of patients by seeing patients. So you're practicing that clinical activity. The emphasis is on both the treatment or also the evaluation and also the treatment, which includes prescribing, but it includes a strong evaluation component of that person or the patients that people are seeing. I cannot comment on medical education. I'm not an expert in medical education. We are the Center for Nursing, so I am very comfortable in commenting on the nursing education. I do also want to comment that Dr. Bradley Kuo does have that psychiatric mental health APRN license if you would like additional information related to that education in particular.
Just wondering, as far as years of education and training before licensure in this or certification in this area, about how long does that take for an APRN?
So it requires a 4-year baccalaureate degree in nursing, and then it's 2 to 3 years of additional education in that advanced practice that requires at minimum advanced advanced pharmacotherapy or pharmacology, advanced anatomy and physiology, assessment, and pathophysiology, so the disease process. In addition to that, there's didactic education on the content area and clinical education. It should be noted that the basis of this education, the basis of the advanced practice nurse is in nursing, so the educational model is different. However, the outcomes of advanced practice nurses is very high quality. It is the very high quality education, very little, I guess I should say it's high quality education, and it is accessible, and it is often at lower cost. And so there's many benefits to the APRN practice becoming more accessible and also retaining the high quality that is expected during patient care.
Okay, great. Thank you. And then one last question. What other states allow APRNs to certify that a person is totally disabled, make capacity determinations, and add APRNs as primary providers in advanced mental health care directives, as this bill is trying to do? Is there a number of states that do this, or do you have that information?
You know, I've been trying to find that information, and it seems that because every state has a different way that their laws are written, I've had difficulty securing the exact numbers, but I do understand that other states do have this authority. I just am not able to refer to a statute, you know.
A number? Like, is it one other state, or like five, or?
No, so I've from the Hawaii State Center for Nursing APRN Practice and Policy Task Force, the APRNs who are licensed in other states have mentioned that they are able to do that in the other states they've practiced, but I don't have a list available. I apologize.
Okay, great. Thank you. Thank you, Chair.
Thank you. Members, any additional questions on HB 302? Okay. Seeing no further questions then on HB 302, we'll move on to our next agenda item, HB 576. This is relating to healthcare. This would authorize licensed physician assistants and APRNs to perform aspiration abortions. First off, we have Leanne Tashima with the Board of Nursing offering comments.
Thank you, Chair. You have recommending that any reference to APRNs in chapter HRS 453, and that a new section be created in chapter 57, just that would allow the Board of Nursing to oversee the APRN scope of practice in this case.
Okay, I guess she's done. We also have Doreen Eddy with the Hawaii Medical Board offering comments.
Good afternoon, Chair and members of the committee. Doreen Eddy, representing Alani Koki, who's the Executive Officer of the Medical Board. You have our submitted comments, and if I can answer the questions, I will answer questions.
Thank you, Doreen. Next, we also have the LGBT caucus of the Democratic Party of Hawaii, Michael Galoyu Jr. in support.
Aloha, Representative Michael Galoyu Jr., representing the LGBT caucus of the Democratic Party of Hawaii. We want to thank you for hearing this bill. We are glad to see that even the opponents to choice for women recognize that it is legal in the state, and that is what we would like to focus on, is that just because it's legal without access makes it gives us no use for women to be able to enact and be able to use the legal laws of the state. So we ask that you pass this bill out to ensure that women all across the state have access to legal medical, what have you, sorry. But again, thank you for hearing this bill, and I'm available for questions, but mahalo.
Thank you. Thank you. We also have Rennie Soon in support with the American College of Obstetricians and Gynecologists, Hawaii section.
Yes, aloha Chair Johansson, Vice Chair Kiyagawa, and members of the committee. I am the chair of the Hawaii section of the American College of Obstetricians and Gynecologists, whose membership includes over 200 of the state's OBGYNs, and we support HB 576, We are specialists in women's healthcare, and as such, aspiration abortion procedures are a routine part of our training. We know this procedure, and with all due respect to my physician colleagues in other specialties or in other medical groups who may be testifying, we are the ones who know the ins and outs of this procedure. Once a physician or another clinician like an APRN or PA has been trained, it is an incredibly low risk procedure. APRNs and PAs are perfectly capable of providing this care safely, and in our written testimony, we've provided references to studies that show this. I know some are testifying that having APRNs doing this procedure would be like lowering the standard of care or giving people less than the best. If I may, I'd like to quickly walk through an analogy just because I think this may be something more of us can relate to. Most of us probably drive cars, and in fact, many may have driven their car today. We probably don't hire a professional driver every time to drive us around because we know how to drive cars. We read the book, we took driver's ed, we took a test, now we drive cars. And most of us know there's a low chance of getting into an accident because the fact is we're usually driving around town without getting into an accident. A professional driver, though, will have more training than most people. They can drive semis or limos or buses or garbage trucks or whatever they were trained to drive. And if we were driving one of those, we'd probably hire someone trained to drive that specialty vehicle because that's a more complicated thing to drive. But when it comes to driving a car, that professional truck driver has no less of a risk of getting into an accident than most of us, because driving a car, once you've learned how to do it and we're following the rules, is low risk. You being on the road, driving your car, even if you are not a professional driver, is not increasing the risk to others and is not lowering standards of care. Hawaii ACOG represents the physicians who know this procedure and provide this procedure every day. Others are testifying to the need for this bill. We are in the unique position to testify to the safety of this bill. We urge you to pass HB 576. Mahalo, and I am available for questions.
Thank you. We also have Linnell Hogan in support with Planned Parenthood.
Hi, hi, Chair Johansson and Vice Chair Kowalski and other members of the committee. My name is Linnell Hogan, and I am testifying in support of HB 576. As a public health student at Hawaii Pacific University, I have realized the number of barriers women endure when seeking reproductive health care in Hawaii. The majority of abortion clinicians are located on Oahu. This forces both doctors and patients to fly out for abortions, putting them at risk for being exposed or possibly spreading COVID. Imagine being a young teen that lives in Kauai who just found out she was pregnant with an unplanned pregnancy during this pandemic. Then imagine being in her shoes when a doctor tells her that in order to get an abortion, she would have no other option but to fly out to Oahu to get the care that she needs. And depending on her insurance, if she has insurance. Most providers will only cover a flight for the patient only and will not cover lodging and food costs. As a young adult myself, I couldn't imagine being forced to fly in a pandemic by myself without a support system just to get the health care that I need. Thank you so much for the opportunity to testify in support of this bill.
Thank you. We also have Laura Reichard again with the Hawaii Center for Nursing offering comments.
The Hawaii State Center for Nursing stands on our written comments. Thank you.
Thank you. We also have ACLU of Hawaii, Wookie Kim, in support.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, and committee members. My name is Wookie Kim, and I'm here on behalf of the ACLU of Hawaii. We strongly support this bill, and we also believe that its passage is necessary for Hawaii to comply with both the Hawaii and federal constitutions. The current physician-only restriction is legally suspect for two reasons. First, it raises equal protection problems. The restriction is irrational because it unfairly targets and prevents certain healthcare providers who, as others have stated, are just as qualified, knowledgeable, and experienced from providing early in-clinic abortion care. There's no justification for this differential treatment, especially when the scientific evidence is clear that APRNs and PAs can safely provide that care. Second, it raises constitutional privacy concerns. The restriction imposes a substantial burden on abortion access and does so without furthering a compelling state interest as required by the Constitution. The burdens imposed are clear. By limiting who can provide this care, the restriction reduces access. The burdens are also, though, amplified by other factors, including Hawaii's unique geography as an island state, Hawaii's ongoing physician shortage, and the fact that we're in the middle of a devastating pandemic. These burdens are also disproportionately falling on people who already face systemic barriers to care, including Black, Indigenous, and people of color, low-income people, and people who live in rural areas. And finally, I'd point this committee to a recent lawsuit that the ACLU filed in Maine, challenging a similar physician-only restriction. Shortly after that lawsuit was filed, Maine passed a law very similar to this bill. In short, we ask that the committee pass HB 576. Thank you very much.
Thank you. We also have Planned Parenthood Votes Northwest and Hawaii, Lori Field, in support. Lori, I think you're muted.
Sorry about that.
No problem.
Good afternoon, Chair Johansson and members of the committee. We submitted written testimony in strong support of HB 576, which seeks to ensure that all people in Hawaii have equal access to abortion care, no matter their income or where they live. Please note that we also submitted with our testimony the names of 180 individuals from across the state who would like their support for HB 576 to be documented. We're also joined today by a number of young people who will share with you just a few of the myriad barriers that stand between people, particularly those on the neighbor islands, and reproductive health care in Hawaii. As a healthcare provider, Planned Parenthood cares deeply about ensuring that its patients receive the care that they need when they need it. And that also goes for our brave and selfless doctors, nurses, and health center staff. Limiting access to abortion care, particularly during a pandemic, endangers their safety and incurs great costs for all, including the state, as they are forced to travel between islands to receive and provide care. Qualified licensed providers like APRNs and PAs can provide early in-clinic abortion care just as safely and effectively as doctors, which is why states across the country are eliminating these unnecessary barriers to abortion care. We look forward to Hawaii joining that growing list, which now includes 12 states, with Massachusetts just recently updating its law. HB 576 will help to keep us all safe by allowing qualified and more widely available APRNs and PAs to provide timely, safe, and local care. Thank you so much for hearing and supporting this important bill.
Thank you. We also have individual testimony and support from Merritt Perlman Shapiro.
Hi, Chair Johansson, Vice Chair Kitagawa, and committee members. I am an obstetrician gynecologist in Hawaii, and I'm testifying in support of House Bill 576. I specialize in women's health care, and a part of my training and practice are aspiration procedures. By allowing advanced practice registered nurses and physician's assistants to perform aspiration abortions, we would increase access to basic health care for the women of our state. I'm one of the few OBGYNs in the state who provide aspiration abortions to my patients. I travel to Maui to perform them, but unfortunately women travel from other islands to Oahu if they need this procedure, taking time off work, needing to find childcare, and risking COVID-19 exposure for themselves and their families. They often ask me why this basic and much needed service isn't offered in their own community. The majority of these procedures take place in the first trimester. I have trained other doctors and medical students how to do aspirations. It is one of the simpler procedures that OBGYNs perform and is expected that our first-year physicians in training can complete independently. I have the privilege to work with highly skilled APRNs and PAs in a variety of clinical settings, and I know that they are more than capable of safely performing this procedure. This is backed by research, by the National Academies of Sciences, Engineering, and Medicine, and by laws in 12 other states. Hawaii has always led the way in reproductive health care, recognizing that abortion access is vital to women's health. The evidence is clear. This is not only safe, but needed. It is time that Hawaii extends access to comprehensive women's health care, which is why I support HB 576.
Thank you, Dr. Shapiro. We also have individual testimony and support from Dr. Alan J. Wieland.
Good afternoon, Chairman and members of the committee. I'm Dr. Alan Weiland, a retired OBGYN physician now living in Maui. And I'm speaking in favor of HB 576. You have my written testimony, but I would like also to voice my concerns about current access to abortion services. There are only a few physicians willing to provide abortion services, and they are constantly under attack all over the country. I was one of them, and I was personally picketed, and I had one husband come after me with a gun in a hospital. Some of my colleagues also received threats to themselves and their families. I'm sure you're aware of the violence against abortion clinics that has resulted in several physician deaths. It's imperative to retain termination services as a legal, accessible option. And to do that, we must expand the pool of qualified practitioners available to provide these services. Early aspiration terminations are a very safe procedure. The complication rate is far lower than forcing a woman carrying an unwanted pregnancy to go through pregnancy and delivery, and can easily be taught, as was previously addressed, to advanced practitioners. I would urge the committee to support this bill, and I'm happy to take any questions. Thank you.
Thank you, Dr. Weiland. We also have individual testimony and support from Leah Minton.
Aloha, Chair Johansson, Vice Chair Kitagawa, and committee members. Thank you for this opportunity to testify in strong support of HB 576 HD1. As stated, my name is Leah Minton. I am an advanced practice registered nurse in the state of Hawaii, and I practice as a certified nurse midwife. I do want to say that in addition to strongly supporting this bill, I also support the recommended edits provided by the Board of Nursing. Because what that does is it helps to get us into alignment with allowing healthcare providers to practice to the top of their scope. And I believe that's really what this bill is about. And when we work towards getting healthcare providers to practice at the top of their scope, that's how we achieve equitable access to all healthcare services in the state of Hawaii. So I just really quickly wanted to walk you through, as an APRN, I am licensed under Chapter 457, which is governed by the Board of Nursing. And under that, with the Hawaii Administrative Rules 89, that basically lists out my scope of practice. And in that scope of practice, it says that I can perform procedures, which I do on a daily basis. Many procedures which carry a higher risk than aspiration abortion. Aspiration abortion risk for complications is 0.25%. And so the state already licenses me, essentially saying as an independent provider that I'm competent to do the things that are listed in my scope of practice. And therefore, we are competent to do procedures. And so if we stopped there, essentially we'd be able to deduce that I would legally be allowed to provide aspiration abortions in this state. However, because abortion is defined under Chapter 453 from the Hawaii Medical Board, that prohibits me from providing them. So as a quick example of a provider in rural area, taking care of a client who initially came to me for prenatal care in their first trimester, and we did establish a heartbeat and a viable pregnancy, which then during the first trimester ended. And in doing my practice of essentially using diagnostic tests to determine that it was a non-viable pregnancy, she wanted to do essentially a removal of the products of conception, but I couldn't offer her that. And in the meantime of trying to get her connected to a provider that could, she ended up miscarrying at home, which was very scary for her and actually increased her risk of having complications because I was not able to provide that service to her. So the reason under this bill that we would recommend a change of some of the language as it's currently written is that the Hawaii Medical Board doesn't have authority to dictate practice over APRNs. So by writing them into that statute, we're now creating a little bit of an issue. However, there are examples within Chapter 453 and 457 that reference each other using language that then allows physicians and physician assistants and APRNs to practice to their top of their scope. And so I just wanted to share that just a little bit of some language change could really help us to achieve the goal of this bill, which is to ensure equitable healthcare access for all, regardless of what type of access that is. So thank you. And I will not be available for questions later. I have to hop to another meeting, but I am happy to meet separately and/or respond to any questions by email. Thank you.
Leah. Next, we have Michaela Sampson as an individual offering supportive testimony.
Aloha, my name is Michaela Sampson. Aloha Chair Johansson, Kitagawa, and members of the committee. I'm testifying in strong support of HB 576. As a student of social work residing in Maui County, I'm concerned about my community's access to abortion care. Currently, Maui residents are only able to access abortion care 2 days out of the month. However, during a pandemic, these opportunities change due to flights and restrictions, doctors not being exempt from quarantine. On top of having limited providers on Maui, our public transportation system is also very restricted, making access for women in more rural parts of Maui very difficult. If this bill were to pass, women in my community would have more equitable access to reproductive health care, such as abortions, in a timely manner. Women in more rural areas of Maui would benefit from the expansion of services as well. Thank you, Johansson and Kitagawa, and members of the committee for taking time to hear my testimony, and I strongly urge you to pass this bill. Thank you.
Thank you, Michaela. We also have Anastasia Sant offering individual testimony and support.
Aloha Chair Johansson, Vice Chair Kitagawa, and members of the committee. My name is Anastasia, and I grew up here on Maui. I urge you to pass HB 576 because I have witnessed firsthand what women go through when they don't have the care they need. When women or adolescents have an unwanted pregnancy and are not able to access safe abortion, they often resort to unsafe methods. For women on outer islands, there are many barriers to access, but having to travel to another island because there are no abortion providers in their community is a major one. I have friends and family members who have gone to detrimental lengths to have an abortion on their own. They have tried black market mixtures, used dangerous drugs, and even physical force. These women were mothers and in abusive relationships and felt that this was their only option in that moment. The stigma from family members, healthcare providers, and the community is already enough of a barrier for women seeking abortion care, but we have the power to make a change in the poor availability of services that our sisters currently face by passing HB 576. Expanding access protects our women in our community. Thank you for the opportunity to testify today. Mahalo.
Thank you, Anastasia. Members, that's the extent of our testifiers who have indicated that they would be present at today's virtual hearing to testify in HB 576. Please note that we have numerous testimonies, organizational and individual, in support and opposition on this measure. With that, we'll move to legislative member question and answers. Members, any questions on HB 576? Vice Chair Kitagawa.
Okay. Thank you, Chair. Can I have, I guess, Laura again from the Center for Nursing? So my first question is there, based on, I read through the consensus model for APRN regulation, and for example, a couple of years ago when we did the midwifery bill, we specified in that bill that nurse midwives were listed as the APRN specialty that would be able to perform and would be licensed for midwifery. Is there in this bill, should there be a APRN role or focus area designated? There are 4 APRN roles. Are there 1 or 2 that get trained in this area, or should it be specialized? Like the previous bill, right, said psychiatric specialization.
I have to apologize that my baby was crying the whole time that you were talking. This is a challenge of working from home. I think if I can restate your question to make sure I heard it correctly, I think your question was if there should be a designation to one of the specific population foci. Is that the correct?
Right. Or even the APRN roles, because there's, the 4 different ones. So should it be one that is actually trained to do this, and should we list that?
I really do appreciate the question. I think because it would be possible for the clinical nurse specialist the nurse practitioner and the nurse midwife all to be trained in adult care, in women's health, both of those, and that's ends up being the majority. Over 90% of, actually more like 98% of the APRNs in our state would fall under those categories. And then in terms of nurse practitioner specialty, there's women's health, family nurse practitioner, adult, and adult geriatric. I think that if you start listing out those specific specialties, it might be too much. And in contrast, if you just allow it to be APRN, the Nurse Practice Act is very specific that only a nurse who is educated and trained in a specific population foci and has any additional training and competencies and skills may perform those skills on that population foci. So I feel like it may be addressed already in our existing scope of practice.
So does that mean that, and I'm just trying to get clarification on how the training is done. Does that mean that for APRNs who are allowed or going to be allowed to do aspiration abortions, there is a set educational track or certificate program? I know that and I read through the study that was done in California about the safety between APRNs, MPAs, and physicians. It included 12 months of clinical experience. Is that the standard of what's required to perform aspiration abortions?
I think for general, when you're developing a new skill, it may be included in your base education. So your graduate education to become a nurse practitioner or a clinical nurse specialist, a nurse midwife. And there's also the potential to get that education afterwards. For instance, taking a workshop or or even doing on-the-job training where there's dedicated didactic training and then simulation, and then patient performing the procedure with a patient, having oversight, and then going on your own. So there's many different mechanisms for lifelong learning. I don't believe that there is a set standard of education for aspiration abortion, but certainly I believe in this state because we do have, and I would have to refer to medicine for this, but because there is training for that obstetric specialty in medicine, that there are existing mechanisms for APRNs to learn that. Today there is we do have 3 APRN programs in our state, and then there are potentials for lifelong learning or education and training outside of that academic setting. But I can't speak to a standard for this because it has not been state law.
Okay, got it. And then just a couple of more questions for you, and I don't know if you know the answers to it, but you know, I've noticed that people who testified today in testimony that
I'm sorry, I no longer hear you. Let me read this.
And so that's part of the time.
I'm sorry, I no longer hear you.
Hello?
Vice Chair, we're having a difficult time hearing you.
Oh, okay, let me try.
We can't hear you.
Why don't we do this? Let's take a quick recess while we ask tech support to come and help, because it's problematic if the testifiers can't hear the members. So quick recess while we ask tech support to assist us on volume issues. Recess. Okay. All right. My apologies to everyone waiting to testify. We just had to work out a few technological issues. So reconvening our 2 p.m. agenda, and we are on HB 576. Vice Chair, please continue with your questions. Thank you.
Thank you, Chair. Laura, I'll just email you with the question, and we can kind of talk about it offline with the questions that I have. So I know you have your baby, so we can. I'll send you an email. I have a couple questions for the medical board. So Doreen, if you're still on. Doreen, are you still on?
Yes, Vice Chair, I'm sorry, I had a little issue.
Okay, thank you. In the current statute, it states that physician's assistants need to practice under the supervision of a licensed physician. In Hawaii, what does this mean to be supervised or have to practice under the supervision of a physician?
Well, and I am not your expert on this because I don't sit on the medical board, nor am I the executive officer, but it's my understanding that in order for a PA to be working in Hawaii, they should be under the auspices of a supervising physician overall.
Does that mean that the supervising physician needs to be in the same facility, or could the physician be on a different island? What is it defined as what supervisory is?
That is beyond my expertise, Vice Chair. I will take that back to the Alani Koki and have her respond to you directly via email.
Okay, great. And then if you can just also let her know that I have some other questions too that I'm not sure if you would have the answers to, that I can send her an email with.
I will have her send you an email.
Okay, great. Thank you so much, Doreen.
Thank you.
Thank you, Chair.
Thank you, Vice Chair. Members, any additional questions on HB 576? Okay, seeing no further questions on HB 576, then we'll move on to our next agenda item, HB 598. This is relating to tobacco products, and this would establish the offense of an unlawful shipment of tobacco products. It increases the license fees for persons. Actually, this part I think was taken out. In addition to various and sundry other tobacco-related mechanisms. We have our first testifier on HB 598, Department of Health, offering comments.
Thank you, Chair Johansson and Vice Chair Kitagawa. I'm Lola Irvin, representing Dr. Libby Char for the Department of Health. So the department offers comments and recommends an amendment. We are grateful that you're hearing this bill because of the concern we have with the increase in e-cigarette smoking use, e-cigarette use by our youth. Our youth are increasing their use of e-cigarettes from 25.5% to 30.6%. And the keiki on the neighbor islands are also regular users at a much higher rate. And so while the regular users statewide went from 5% to 10%, on our neighbor islands in Kauai, for example, the youth who report using on a regular basis 20 days out of 30 days went up to 15% by 2019. And we know that shipping and handling online is a way that our keiki are getting marketed to and also then procuring these items. And that even if the US Postal Service will no longer be allowed to ship these directly to Hawaii, the private postal services will still be able to ship these products to Hawaii. So this would be an effective prevention method for our keiki. So I thank you very much for the opportunity to provide testimony. And we do have the amendment that we offer on the back of our testimony regarding our request that the definition for tobacco be reinserted into the bill. Thank you.
Thank you. We also have the Department of Taxation offering comments.
Good afternoon, Chair Jacob Hurlitz. On behalf of the Department of Taxation, we'll stand on our written testimony offering comments. Thank you.
Thank you. We also have Tax Foundation of Hawaii offering comments. Tom Yamachika.
Thank you, Chair and members. Tom Yamachika from the Tax Foundation will stand on a written testimony. We just wanted to emphasize that if you are thinking of funding a program or two out of this or any other sin tax, you really should think again, because as the data referenced in our testimony show, the tax take on taxes like this has been declining and will probably continue to do so, especially if the social policy that you are trying to further does take hold. Be happy to answer any questions.
Thank you. We also have the Hawaii State Teachers Association in support. Mitzi Higa.
Aloha, Chair. Mitzi speaking on behalf of Corey Rosenthal, President of Hawaii State Teachers Association. As the Health Department has said again and again, our youth vaping is going up. We are highly concerned. We are asking for an amendment to this bill to create tax parity between electronic smoking devices and other tobacco products. Just when our youth it went down that they were using regular tobacco products, but now that vaping industry has come in untaxed and not with tax parity with tobacco products, the youth vaping is an epidemic. It has gone up every quarter. When our students are in school, the high schools are collecting 2 big rubbish bags of vaping products. It's out of control. One thing that stops youth vaping, other than blocking access, limiting their access, regulating the industry, taxing, creating a higher price point also helps tremendously. So we ask you, please create a tax parity between electronic smoking devices and other tobacco products by putting back in the language of describing what tobacco products are that include electronic smoking devices. Thank you.
Thank you. We also have the American Heart Association, Don Wiseman, with comments.
Thank you, Chair Johansson and Vice Chair Kitagawa, and thank you both for introducing this bill. And we are, like the other testifiers you've heard in favor of this, we are recommending that you amend this bill back to its original language, because it was a very strong bill to begin with, and it's going to take a comprehensive effort, like we saw with traditional tobacco products, to bring the numbers down on our youth vaping rates now. And this bill would have done that, but it was weakened by the change in language. So we're recommending that you move back to the original language, create tax parity, and make sure that the definitions of e-cigarettes remain consistent as they stand now. So as new products come on the market, they'll be included in any legislation that's in place. It's a very important issue. You heard the Department of Health say that the latest numbers that just came out yesterday show that our rates are continuing to climb. That puts our children at increased risk for future heart attacks and strokes, as well as becoming infected with COVID-19. So we ask you to make those amendments as recommended, and please support the bill. Mahalo.
Thank you. We also have the Hawaii Public Health Institute, Jessica Yamauchi, in support.
Thank you, Chair, Vice Chair, members of the committee. Jessica Yamauchi with the Hawaii Public Health Institute, which houses the Coalition for Tobacco-Free Hawaii program. Similar to the previous testifiers, we support the original language of this bill, and thank you for introducing this. With the removal of e-cigarettes from the tobacco definition in HD1, it's unclear if this bill applies at all to e-cigarettes. So the original language would tax e-cigarettes at a rate that would gain parity with cigarettes. It would require a tobacco license and permit, and would restrict online sales to those with except to those with a tobacco license. You do have our written testimony in support of the original language, and we have really been working on these regulations proposed in the original bill for over 5 years. And each year that this bill fails, we fail our children. And as you heard from the previous testifiers, our youth e-cigarette rates continue to rise each year. And now we have 1 in 3 high school students reporting regular use. We've seen the comprehensive regulation work with decreasing our cigarette rates, and we really need to apply the same regulations to e-cigarettes. So we thank you for the opportunity to hear this bill, and we hope that the committee will consider reverting back to the original language. Mahalo.
Thank you. We also have the American Cancer Society, Cancer Action Network Hawaii Pacific, Cynthia Au in support.
Good afternoon, Chair, Vice Chair, and committee members. Cynthia Au testifying on behalf of American Cancer Society, Cancer Action Network. We support this measure and offer amendments. Our organization echoes a lot of what the previous testifiers have said. We want to highlight in our testimony that we are concerned about new categories of products that might be exempted from taxation and request for the definition to be amended to have electronic smoking devices added to the definition of tobacco as written in our submitted testimony. And just to emphasize again the importance of licensing and permitting of tobacco retailers and wholesalers selling electronic smoking devices for tax parity, because licensing and permitting is especially important for enforcement purposes. Thank you again for the opportunity to testify and for hearing this bill today. Mahalo.
Thank you. We also have the American Lung Association, Pedro Haro.
Aloha, good afternoon, Chair and Vice Chair. I would like to point out that we are asking for the same amendments as the other testifiers, so I won't bore you with that again. But at the risk of seeming like a brown noser, we do appreciate the language that were introduced by the Chair and Vice Chair in the original form. Thank you.
Thank you, Pedro. We also have Aloha Care, Trish Lachika in support.
Aloha, good afternoon, Chair, Vice Chair. Thank you so much for introducing this measure. We also echo the amendments mentioned by the previous testifiers. We also wanted to applaud both of you for also including an appropriation that goes towards tobacco prevention and education programs, as currently none of the current tobacco taxes go towards tobacco cessation, and this is much needed for our youth and other individuals who would like to quit. Mahalo.
Thank you. We also have the Retail Merchants of Hawaii, Tina Yamaki, in opposition.
Aloha and good afternoon. I apologize for not being online earlier. I had some technical difficulties as well. We are in strong opposition to this bill, and you have our testimony on file, but I just wanted to point out that, you know, retailers are not out there selling e-cigarettes and all of these e-products to those who are under 21 years of age. What we are seeing is their parents are coming in, it's adults coming in, legally purchasing these items and then handing it off to the minors. We cannot control our products once they leave the store and what happens to them. But this is what we've been hearing and how a lot of the youth have been getting a hold of it. Also, to order things online, it's not that easy. You have to prove that you're 21 and your credit card has to match all of the information. So there are stops online for online sales as well that we wanted to point out. But yes, we are opposed to this measure. Mahalo.
Thank you, Tina. We also have individual testimony from Les Drent with comments.
Yes, thank you. Paying attention to another bill, another committee, but thank you for having me on. I'm just wanted to add some comments to this bill and also 476. I am a farmer over here in Kauai. We've grown coffee, chocolate, corn for our whiskey business, and tobacco for many years for Kauai Cigar Company. You know, when I first started at the legislature lobbying 8 years ago, I met with then Senator Ige, who was the Ways and Means chair, and I tried to come in to the legislature with a definition for premium cigars. And 8 years later, Senator Ige sent that through, and it went through, and we actually got to conference committee for a few years there, got very close to getting a tax cap on our cigars. But I think with the language in this bill and the discussion of modified risk and the discussion of the different tobacco products, I really think it's a good opportunity, as my written testimony says, to look at what the FDA has been doing with premium cigars and the definition that they've laid out, showing, you know, demonstrating that it is not a product that is marketed or used by the youth. My wife is a teacher. I have a 16-year-old daughter. And I also have a 13-year-old son. They're happy, healthy kids and have in no way any exposure to tobacco, and the dad is a tobacco farmer. So I'd like to just ask you to consider perhaps amending this bill to include the language for a premium cigar category. I think the time is ripe. I think a lot of people realize that the black market exists out there for cigars. It's a wealthy, well-to-do product of people that have money and means to move cigars from wherever they want, whether it's Cuba, Nicaragua, the Dominican, into the US and out to Hawaii. And I really think that you're just really cutting off your nose to spite your face and losing out on a lot of tax revenue when you're not allowing local producers like myself to compete in this market and collect the taxes for you. So once again, I'm not here to really discuss a tax cap, but I think the time is now to really probably look seriously at the premium cigar definition that the FDA has laid out, and I've cited that reference, and to consider adding that category and codifying that language. I think it would do Hawaii a lot of good to be able to help have control and tax revenue from that product while also not harming local farmers and retailers like myself. So thank you. I appreciate the time. If you have any questions, I'd be happy to answer them. Aloha.
Thank you very much. I will also remind all testifiers that we need to ensure that your backgrounds are not an infringement of somebody else's copyright. So if you are including political cartoons drawn by someone else, if you do not have the express permission to use it, it should not be used as a background. And I would just ask to make sure that everybody is utilizing appropriate backgrounds, as this is a public forum, and also typically we would not be having signs and other things at our regular in-person hearing. So I'd ask testifiers to be mindful of their backgrounds, that they are not infringing on someone else's copyright, and to ensure that it comports with general rules of decorum. Next, I believe that's all the testifiers who have indicated that they would be present in today's hearing on HB 598. Members, please note that we have additional testimony in support and opposition from organizations and individuals. Members, any questions on HB 598? Okay, thank you. Seeing none, then we'll move on to our next tobacco-related agenda item, HB 476. This is relating to taxation, and this is more of our vehicle that actually includes tax parity by imposing a 50% tax on products with a modified risk tobacco product order issued by the Secretary of the U.S. Department of Health and Human Services. It establishes taxation of e-liquids used in electronic smoking devices and requires wholesalers and dealers to be licensed. It requires retailers of tobacco and e-liquids to also obtain permits. First off, we have the Department of Health in support.
Thank you, Chair Johansson and Vice Chair Kitagawa. I'm Lola Irvin, representing Director Libby Char for the Department of Health. The Department of Health supports HB 476, House Draft 1, and we also offer amendments. We do request that the tax have parity for electronic smoking devices, and that ESDs would be taxed at 70% wholesale price, so there would be parity with other tobacco products. We do know that pricing works for our keiki, and that nicotine is dangerous for developing brains, and with the high rate of our youth who are using nicotine, we are very concerned about their development, since nicotine primes the young developing brain for other substances. It can create mood disorders, it can disrupt their sleep, and it can also disrupt their attention and their ability to retain information. And now with youth going back to schools and into the classrooms, we're concerned about the culture of sharing these products, because that's what the youth have told us. And so we would request that this be a prevention bill, and we do offer amendments with definitions that we're requesting. Thank you for the opportunity to provide testimony.
Thank you very much, and thank you for your work on the issue. We also have the Department of Taxation with comments.
Good afternoon again, Chair Jacob Hurlitz, Department of Taxation. We will stand on our testimony offering comments. Thank you.
Thank you. We also have the Tax Foundation of Hawaii, Tom Yamachika, offering comments.
Thank you, Chair and members. Tom Yamachika from the Tax Foundation. We will stand on our written testimony. Our remarks are basically very similar to those in the prior measure. We'd be happy to answer any questions.
Thank you. We also have the Hawaii State Teachers Association, Mitzi Higa, in support.
Just again, speaking for Corey Rosenlee, President of Hawaii State Teachers Association, similar to our previous testimony, we have the same comments for this bill as well. So I won't waste your time. It's important, but I've already said it. Thank you.
Thank you, Mitzi. We also have the American Heart Association, Don Wiseman, with comments.
There we go. Yes, again, thank you, Chair Johansson and Vice Chair Kitagawa and members of the committee. We're in support of the bill, but intent of the bill. The changes, again, we recommend are similar to the Department of Health, which is to create tax parity. If you don't have a level playing field, then the industry will manipulate kids to go for the cheaper products. And so we recommend that the tax be raised to 70% of the wholesale price as other tobacco products are. And you've got my written testimony. If you have any questions, I'll be here. Thank you.
Thank you. We also have the Hawaii Public Health Institute, Jessica Yamauchi, offering comments.
Yes, thank you, Chair, Vice Chair, members of the committee. Similar to the previous testifiers and our previous testimony, we do support taxing e-cigarettes, but this does fall short of achieving parity with cigarettes. In addition, I just wanted to note we are quite concerned about the addition of the definition of modified risk tobacco products on the first page of the bill. And ultimately, we prefer the original language of the previous bill to achieve the regulations needed for parity with cigarettes. Thank you.
Thank you. We also have the Hawaii Cigar Association, Les Drent, offering comments.
Yes, hello. I appreciate your time again to letting me testify. I'd also like to add that the background that I used in that previous testimony is copyrighted, and I own the copyright on that. John Pritchett is a good friend of mine, and I'm happy to commission him to do these political cartoons for me to use in my business. So I just wanted to let you know that there was no infringement there, and if I could have my background restored, that would be great. But same thing, I'm just really just pointing out the fact that, you know, if we're looking at definitions and talking about modified risk and these other tobacco products, that the FDA has laid out a pretty good roadmap for defining premium cigars, and the definition that I have put into the written testimony. And I would just ask the committee if they would be kind enough to discuss that inclusion of the premium cigar language for all the other reasons that I stated in my previous testimony. So we're not encouraging the black market movement of cigars, helping the Department of Revenue collect taxes on cigars, and ultimately helping local farmers and merchants like myself. So thank you very much. I appreciate it. I just want to clear up that the background there, that I do have the rights to it. I did pay for the artwork. Thank you.
Thank you, Les. We also have the American Vaping Association, Gregory Conley, in opposition.
Good afternoon, Chair and members of the committee. My name is Gregory Conley. I am an attorney in New Jersey, and I am the president of a pro-vaping advocacy group called the American Vaping Association. We submit written comments in opposition to 598 HD1 as well as this bill. While we oppose all excise taxes on vaping products out of a concern for adult smokers, of which there are still 130,000 in Hawaii, we do appreciate the willingness of the bill's sponsors to ensure that the tax rate is not set at such a rate that combustible cigarettes that kill 450,000 people every year have a competitive advantage. That is exactly what a 70% tax rate would do. This system of bifurcated taxation is used in states like Connecticut and several others outlined in our testimony. It's a smarter way of regulating these products that the FDA will be deciding which ones stay on the market on the basis of what products are appropriate for the protection of public health. That is a tough standard for a nicotine product to meet, but that is the standard the industry is now complying with at the FDA. With regard to modified risk taxation, that is also in several states, and I'm glad to answer any questions about that. But there is some concern. The actual language in the bill seems to set a 50% tax rate for products that have the MRTP application authorized by the FDA. Other states have positioned it where if you get an MRTP, which is a high bar, a very multi-million-dollar process that only 2 products have achieved, that other states have it set up like Colorado, where you get a 50% reduction in whatever tax category you're in, whether a cigarette, whether OTP, whether in this case vapor. So I'm just confused a little bit about the language, but I'll rest on that. Thank you very much.
Thank you. We also have the Campaign for Tobacco-Free Kids, Liza Ryan Gill, with comments.
Aloha, Chair and committee members. Thank you so much. I'll stand on our comments and support, much of our colleagues that are here, saying that we appreciate the intent of the bill, but we would like to see it at parity with other tobacco products. Our youth, this is an incredibly important moment to take action for them on the youth vaping crisis, as kids that use vaping products, which is nearly 1 1/3, are 5 times more likely to be diagnosed with COVID. So this is critical for all of our health in this moment. And we just point you to our comments and thank you for your time.
Thank you. We also have the American Cancer Society, Cancer Action Network, Hawaii Pacific, Cynthia Au.
Thank you again, Chair, Vice Chair, and committee members. Cynthia Au testifying on behalf of American Cancer Society Cancer Action Network. We submitted comments and we thank the committee for the intent in the measure. We echo the other organizations that both all e-cigarette products, including both liquid and devices, should be taxed at 70% of their wholesale price in line with other tobacco products. But we are also concerned about the new categories of products that may be exempted from taxation and recommended that electronic smoking devices be added to the definition of tobacco and not to have e-liquids defined separately. The industry wants e-liquids separately defined to create this 2-tier tax system that would benefit the tobacco industry. Thank you again for the opportunity to testify and for hearing this measure.
Thank you. We also have the American Lung Association, Pedro Haro, offering comments.
Aloha, Chair, Vice Chair. Thank you so much for listening to my comments. Pedro Haro, Executive Director of the American Lung Association. We stand by a written testimony. The one thing that I wanted to point out from our written testimony is that the American Lung Association has launched a campaign that's called Quit, Don't Switch. What we're finding is that youth, when there isn't tax parity, we find that particularly youth will switch from one product to another. So it's incredibly important to be able to bring that tax parity among tobacco products so that our cessation efforts and our various tobacco control efforts are met with a response with the youth and don't just switch into a different tobacco product. Thank you very much.
Thank you, Pedro. We also have Aloha Care, Trish LaChica, in support.
Aloha, Chair, Vice Chair. Trish LaChica testifying on behalf of Aloha Care in support, offering comments. Just wanted to add that noting that modified risk tobacco products were not originally addressed, and that although we appreciate the legislature's intent to tax MRTPs, that despite being designated as modified risk, that these products are still not safe, as all tobacco products still carry a level of risk in their use, and in fact may create some public confusion if carving out these products. If taxes were inserted back into the previous bill, House Bill 598, we believe that would be a vehicle that would create a more comprehensive and stronger solution on the regulation of e-cigarettes. Thank you again for the opportunity to testify.
Thank you, Trish. We also have the Retail Merchants of Hawaii, Tina Yamaki, in opposition.
Yes, we stand on our testimony and will be available for comments. Thank you, or questions.
Okay, thank you. Members, that's all the present testifiers on HB 476 who've indicated that they wish to testify in the virtual hearing. Please note that we're also in receipt of numerous testimonies, both from organizations, businesses, and individuals offering comments, opposition, and support on this measure. Members, any questions on HB 476? Okay, seeing no questions, then we'll move on to our last tobacco-related, or smoking-related, I should say, measure on this agenda, HB 826. This is relating to electronic smoking devices. This would enable the Attorney General's office, instead of just registering ESDs, to also go out and enforce the products that are on shelves, whether they're appropriate or not, based on the pre-market tobacco application, as well as current federal law. In addition, it would increase, I should say, the fines that are levied on people who are smoking, who are vaping, excuse me, underage. First off, we have Department of Health in opposition.
Thank you, Chair Johansson and Vice Chair Kitagawa. I'm Lola Irvin, representing the Department of Health for Dr. Libby Char. So the department respectfully submits opposition to HB 826 HD1. It is not going to protect our children if we penalize them. And so what we are requesting is that we would have a way to regulate the e-cigarette industry that is directly marketing to our keiki. Our keiki are very technologically smart, and unlike during my time, where my parents knew what I was watching with our keiki, the industry can market their products directly to them in their smartphones. And this bill would propose to actually penalize youth who purchase and possess the products. And we know that evidence shows that this type of method does not work. And for some of our youth who are in more fragile, vulnerable family situations, this could put them in a more precarious situation and difficult relationship with their family. And some of the children are also hana'd. And so we're really concerned about their safety if we increase penalty. So we respectfully oppose HB 826 HD1, and we thank you for the opportunity to provide testimony.
Thank you. We also have the Attorney General's office, Deputy Attorney General Richard Stacy, in opposition.
Hi, good afternoon, Chair, Vice Chair. I'm from the Tobacco Enforcement Unit of the Attorney General's. Obviously, this would impact us. We do support the fight against the vaping epidemic, which has been addressed in the last few bills. We do oppose this bill for a couple of very specific reasons. Section 2 would expand the use of our Tobacco Enforcement Special Fund, which we're required to use to abide by the Master Settlement Agreement. So diverting any of that special fund might cause Hawaii to risk losing millions of dollars in MSA money that we receive every year. The other main concern is Section 5 would expand responsibilities of the department without the resources necessary to carry those out. Again, anything that stretches out our current resources from tobacco enforcement for the MSA would put us at risk of major losses. I've noted other comments and I am available for questions.
Thank you. We also have the Hawaii State Teachers Association, Mitsuhiga.
Aloha again. This one we're definitely going to speak on, and it's a mixed bag of whether we support or we oppose this, and that's because of the penalties, the youth penalties. That is not any. So many studies have shown that youth penalties do not work. Our youth should not be punished for predatory marketing practices by the vaping industry. In 2009, the FDA banned these flavors from being in regular tobacco products, and why they are allowed in current vaping products like vanilla, gummy bear, sour heads. There's so many. We just want an amendment to ban flavored vaping products, make the taxes the same as other tobacco products, and definitely do not fine our youth anymore. It's ridiculous to fine them. That's not what has proven to work. What works is regulation, taxation, and banning the flavors. Thank you.
Thank you. We also have the American Heart Association, Don Wiseman, in opposition.
Yep, if I can get myself. I can't get my. I'm sorry, can you hear me?
Yes.
Okay, sorry, I'm having some problem with the technology. Yeah, I won't repeat what everyone else has said, but we are pretty much in agreement with the other testifiers in opposition to this bill. We strongly oppose youth penalties. Not only are they not effective, they can actually be counterproductive to reducing youth use of e-cigarette products. And they can also exacerbate inequities, social inequities. It would create hardship on the poorer people who are targeted by the industry, who whose kids would more likely get caught more often because they use them more often, and put them at hardships in trying to pay these penalties without actually providing any real positive result in helping their kids quit. So we oppose this, and the system that we have in place for preventing illegal sales of traditional cigarettes has been very successful in our state. So why we wouldn't follow that same model for e-cigarettes doesn't make any sense to me. So we would suggest that you hold this bill. Mahalo.
Thank you. We also have the Hawaii Public Health Institute, Jessica Yamauchi, in opposition.
Yes, thank you, Chair. We'll stand on our testimony in opposition, echoing many of the comments you've already heard. Thank you.
Thank you. We also have Trisha Chica, Aloha Care, in opposition.
Aloha, Chair. We also stand on our written testimony in opposition. Thank you.
Thank you. We also have Cynthia Au, American Cancer Society Cancer Action Network, in opposition. Cynthia, are you still there? American Cancer Society Cancer Action Network. Okay, in opposition. And we also have individual testimony in opposition by Gregory Conley.
Good afternoon, Chair and members of the committee.
I'm sorry, this is organizational testimony, excuse me. Please proceed. Sorry about that, Mr. Conley.
Thank you, sir. Chairman and members of the committee, my name again, Gregory Conley. I'm an attorney and the president of a nonprofit called the American Vaping Association. You've already heard some concerns about some of the language within this bill. We're concerned with the section giving the Attorney General the power to enforce the 84-page Federal Tobacco Control Act and the thousands and thousands of pages and regulations and court cases that have come out interpreting that act. What you're talking about looking at is the pre-market tobacco application process that all retailers, or rather manufacturers, are going through at the moment. PMTAs, until the FDA actually releases a list, which due to COVID-related slowdowns is not likely to be any time in the near future, it will be nothing more than a fishing expedition every single investigation, because there will not be a list for the Attorney General to refer to see, is this a product that has a PMTA? Also, our written testimony includes some information about the ambiguities in the bill, where for the purposes of the Federal Tobacco Control Act, only products that are intended or expected to be used with tobacco-derived nicotine will be regulated by the FDA, whereas Hawaii's definition of ESD is intentionally expansive to include devices intended for marijuana, devices intended for CBD or CBD liquids. So there's going to be some ambiguities there as well due to the conflicting definitions. Thank you very much.
Thank you. Members, please note that's all the present testifiers on this measure, indicating that they would be present to testify. We also have numerous testimonies offering comments and opposition on this measure. Members, any questions on HB 826? Okay, seeing none, I have some questions, if the members will indulge me. Department of Health, real quick. And while we're queuing you up, Department of Health, I will preface it with, as this is my bill, the main portion of the bill that I am concerned with is actually the enforcement mechanism. But I do think it's important to consider all ways of potentially deterring youth vaping. And at the behest of several members, I put in that section into the bill specifically about fines. So I appreciate everyone's testimony and their comments. Department of Health.
Yes, sir.
Do fines exist presently, levying a penalty on youth for underage vaping?
Thank you, Chair, for the question. Yes, currently there are fines that are levied. There are $10. There are also there's also community service that is available, for
Can't pay. Is that correct? The community service option is in the event that someone is unable to pay the fines?
yes, sir.
Okay. Has the department tried to repeal these existing fines?
We have actually, yes, sir.
Okay. And so far to date, unsuccessful.
Yes. If I may add a bit of new information.
Please.
I know that there's been interest in terms of them providing youth support if they are using e-cigarettes and they need to quit. And so if they're caught in possession, we do actually have a new youth quit vaping program that's available through the Hawaii Tobacco Quit line called My Life, My Quit. And when a youth goes through that, they can actually get a certificate of completion. So that would be something also to consider. And that is something that we'll work with the schools to promote. And so it would be an alternative to suspension, an alternative to youth penalties. Because what we really want is for the youth to have healthy outcomes. And so we have worked really hard to provide that intervention. Thank you for the opportunity to provide a few more details.
Thank you. And thank you again for your work in this space. Next, Attorney General's Office.
Okay, hello.
Hi, and thank you very much for our conversations to date. I just want to basically understand that I'm distilling your testimony correctly. The gist of your opposition is one, whether diversion of any master settlement agreement monies potentially jeopardizes Hawaii's master settlement funds under the Tobacco Master Settlement. And two, that any additional mandates on you without appropriate resources, or your division without appropriate resources, then potentially risks compromising compliance with the Master Settlement Agreement. Are those that two fair characterizations of the main gist of your opposition?
Essentially, yes. The first part is not just master settlement money. It includes cigarette tax money, but it is in the Tobacco Enforcement Special Fund, which is in 2815. And you did, everything else is right on point.
Okay, and so it's the diversion, just for my own clarification, it's the diversion of potentially master settlement agreement monies, which, you know, this bill might make additional duties eligible for qualifying for those funds. It's hinged to the master settlement agreement, right? It's not tobacco cigarette taxes, is it?
Well, it's the combination, but yes, we have to comply with the master settlement, and in doing so, we have to enforce mostly regarding tobacco under Hawaii state laws, including Chapter 675 and 486P, which were put in place to abide by the master settlement.
Okay. How much, what percentage of the master settlement agreement goes to the general fund now?
Well, I am informed that it should be about 46% based on Section 328L2, I believe.
Okay. So of that 46%, do you happen to know what uses they're used for, or because it's in the general fund, it's sort of anybody's guess?
I would not know if it goes to the general fund. Department of Health is more involved with what goes where with the monies. We get a chunk of master settlement money, and we get cigarette tax money, but the rest is mostly handled by Department of Health, and they might clarify. But general fund, I don't know that Department of Health would necessarily know.
I don't know that it specifically tracks every cent of where it goes.
Yeah, I don't know.
Okay. And then lastly, thank you so much, Richard. I can understand no department wanting to take on basically unfunded mandates with no additional resources, but does it cure your second opposition point to the bill if it's explicated that, one, it's not meant to divert your present staff away from your, currently requisite duties to comply with the master settlement agreement, and if it's explicated specifically that there are additional resources available to you to help effectuate these new enforcement provisions, does that cure your secondary oppositional point to this bill?
Yeah, my main concern would be that we remain intact and separate. If there's separate resources and that it doesn't cut into our MSA tobacco enforcement, then that would go a long way toward addressing my concerns.
Okay, thank you. Thank you very much. And then lastly, and thank you members for your indulgence. Jessica Yamauchi, are you still on?
Yes, I'm here.
Okay, thank you so much. Just a quick question for you. I can understand the opposition to the penalties on youth. That's your and most people's primary opposition. I understand that the enforcement mechanism may not necessarily be enough for you, but is it a fair characterization that many of the advocates don't oppose the additional enforcement mechanisms to try to ensure that the products that are being sold on the shelf are safe? It's more the opposition hinges on the penalties provision, potentially enhanced penalties.
Correct. Enforcement on regulations of the sellers, the businesses, I don't think is where the opposition comes from. It's really on the penalties on the youth.
Okay, thank you so much. I appreciate it. Members, any additional questions on HB 826? Okay, seeing none, thank you. Then my thanks to everybody for this on the tobacco and smoking and vaping section of the agenda. Next, we'll move on to HB 1243 relating to hemp. This would clarify the regulation of growing hemp, hemp processing, and hemp product manufacturing in the state. Let's see. We have Department of Health in support.
Good afternoon, Chair, Vice Chair, and committee members. My name is Greg Edwards with the Department of Health, Food and Drug Branch. We just stand on our written testimony and support, and we are available for any questions you may have.
Thank you. We also have the Hawaii Hemp Farmers Association in opposition, Ray Maki or Gail Byrne-Faber.
Are you there, Ray? I guess I can go if he just got on. I know we've been in the field. Not sure if you folks can see me or not, but thank you for your time today. And I know it's getting late.
Thank you for your patience.
Yeah, of course. Yeah, and I look all bundled up because I just came in from the field. It's raining in Kohala. So thank you guys. My name is Gail Byrne-Baber. I'm the Vice President of Hawaii Hemp Farmers Association. And my husband has been farming here in Hawaii organically and regeneratively for 40 plus years. We got the first hemp license in the state and the first one under USDA, which primarily means I'm good at paperwork, but, but my husband's a really great farmer. We're opposed to this bill for a number of reasons, but if it's going to move forward, we've asked for the amendments that are in our testimony and we stand on those. And I think I just want to step back for a minute and say I had an enjoyable conversation this morning with the sponsor and representative for this bill and two national experts on the health side of cannabinoids and hemp. And Dr. Jenkins, who was on the California Advisory Board in establishing the rules and policies for California around hemp and cannabinoid products, and also sits on several national boards and is going to be speaking with Kamala Harris next week. She's high up there. She knows what she's talking about with regard to this stuff. So we had a fun conversation this morning, and my big takeaway, which I've thought for a while, all of us that do research on this, is that cannabinoids are safe. Hemp products are safe. You can juggle a bottle of it and the kids are going to be fine. Safety is not the issue. I'm more concerned about the sugar and other things we've been hearing about that are out there. So we're opposed to limiting the age restriction. It sends a message that hemp and hemp products are illicit, and they're not. So what we've offered is compromise language, or language that really gets to the heart of the problem, which is marketing that targets kids. No one likes that. I don't like seeing that around technology or cereal or anything. I'm a mom. Us doctors and nurses and the rep this morning, we were all moms talking, so we get it. But this would be an example of over-regulating hemp again and missing the target. The target is a few folks that are using marketing practices that are inappropriate. So we've suggested language that has to do with marketing practices that it's not about regulating hemp. The other thing I'd like to say is there's no reason to eliminate leaf products. There's no THC in the leaf. I mean, we can have teas. That's one thing the farmers can do to make money. As you guys know, I mean, you've heard our testimony now for a couple of years. According to the leading hemp economists, we're way overregulated in Hawaii. That's why all the hemp farmers are losing money. We're way behind the game, even though we're out there front. And all these little tweaks and twists each year just put us farther behind. And instead of making money for our communities, which we could be, and improving food security here, because a lot of our strategies and policies are tied to that, you know, we're not doing that because of all these small little tweaks and regulations. Thank you for the language in eliminating the manufacturing buffer. That there was no need for that. The other thing I'd like to say is that we'd like to see added into this bill language that supports manufacturing in food hubs and food kitchens. That might allow some special funding for farmers to be able to compete in this market. And that's kind of an easy, low-hanging fruit. We'd also like you to add to this bill the elimination of the double oversight we have with regard to farming. We are the only state that double regulates farmers in the hemp market. We are regulated by USDA, and we were told Hawaii could no longer afford to have a hemp program. And so we were moved under the federal program, even though we didn't want to, because it's much more onerous. And most of the other states are still under their pilot programs, you know, for at least another year. And we were told because there are money restrictions, and yet there's still funding available. It's going to the Department of Ag to require farmers to get permission to import seeds and buy seeds whenever we want. There's no other state that does that. It's crazy. So we're hoping you can eliminate that, and also movement, having to say if we're moving the hemp, you know, if we're selling or whatever, no one else does that type of tracking of the farm from the Department of Ag. Is double regulation. This bill also, I think it was Department of Health comments, or this bill suggests that we should punt the age restriction enforcement down to the counties. That would be triple regulation. You want to talk about a nightmare regulatory mess. It's the states that did all this multiple layers of regulation on hemp, and all of them are backing off because hemp is benign. Cannabinoid products, especially full spectrum, are benign. We actually need it. It's nutrition, it's food. So we know that this is a manufacturing and processing bill, primarily put forth to clean up some language and address some current concerns that the sponsoring representative had. But just like our agricultural and farming bill got significantly amended last year to address manufacturing and processing, we're hoping this committee can work in the important language we need on the agricultural side, which is, again, the food hub and kitchens being able to manufacture there, and then also eliminating the double regulation of farmers having to seek permission to buy seeds and to move our biomass. It's absolutely, it's you know, as a former Department of Ag.
Starting to summarize, please.
Oh, sure. So, you know, basically what all this small regulation does, it makes us non-competitive. We're absolutely non-competitive. The experts in the field say that about us. And I'll just quit by saying that we're so happy to hook any of you guys up with scientists, doctors like we did this morning, national and international experts, policy strategy people from other states, because I know we don't necessarily have that out here. So if anything I said you need more information about, or you want an expert, we'll bring it in. But our testimony, I think, is sound, and it's what farmers need. It's what our rural communities need to make this a vibrant economy. So especially now. Thank you for your time. Aloha.
Thank you very much, Gail. We also have the Hawaii Royal Hemp, Clarence Baber. I guess
That's my husband, and he's in the field, and he's not going to.
In opposition as well. Thank you, Gail. Members, please note we also have oppositional testimony both organizationally and individually on this measure as well. Members, any questions on HB 1243?
Oh, pardon me. I think Vincent Mina from the Hawaii Farmers Union United is on, and they wanted to testify.
Okay. If members, this testimony is included. If the Hawaii Farmers Union United is on, Vincent Mina, please go ahead.
Aloha, Chair Johansson. Thank you so much. Gail covered a lot of the detail that basically needed to be covered in that respect. What I would like to touch on, as a producer and a farmer for the past 27 years with my wife as a family farmer, most of our chapters, we have 13 chapters throughout the state, our presidents are producers. And that was specifically done to make sure that people understand that when you talk about agriculture, you need people that are in the trenches every day to get access to those people who are living it, to share their know as to what truly farmers need. So my suggestion with all of this is to slow down, get the farmers in the room with the legislators and sit down and talk story with the farmers so you can truly get what is the issues here and how to mitigate those issues. So this way we can utilize this most amazing crop. I have a 90-year-old Hawaiian Portuguese father-in-law who is cantankerous to get along with. And yet at the same time, he's been drinking hemp leaf tea. And thank goodness for this, because he's so mellow now and so nice to be around him. And, like Gail was saying, this is a food. We have an endocannabinoid system that accepts these cannabinoids, receptor sites, for us to be able to utilize and be as authentic of who we are. And I don't do drugs, and yet at the same time, I utilize these cannabinoids for back issues. I rub the oil into the back. I get relief from that. It's just an amazing crop, and on so many different aspects that for some reason is getting a really bad rap. So I don't believe in anything that's going to alter the mind. I'm in the position of being in the trenches, a farmer, to have a support system there for me to be able to continue to farm. And then I support and represent other farmers, and it's really distressing to me to see the regulatory aspects of what Hemp represents. I sit on the Board of Agriculture, but I'm here testifying today as president of Hawaii Farmers Union United and as a family farmer who wants to grow hemp himself. But yet, I'm just looking at all these regulations, and it's like, it's not supportive of our farmers. So I would appreciate if we would, take this bill and get it off the docket at this point in time to where you can truly then sit down with the farmers and get some inside scoops as to what's going on in the trench. Because I feel that's the biggest issue with agriculture here today in Hawaii, is that decisions are being made by people who aren't farming for a living. Thank you.
Thank you very much, Vincent. Members, again, that's the extent of our testifiers on HB 1243. Members, any questions on HB 1243? Okay, seeing none, we'll move on to our next and second to the last agenda item, HB 1144, relating to agriculture, and this would exempt from the general excise tax law amounts received from inter-island transportation and related loading and unloading of livestock. This requires the Public Utilities Commission to authorize preferential water carrier service rates by tariff for ratepayers that operate farms or ranches located in any county with a population equal to or less than 500,000. Let's see. We have Department of Taxation with comments.
Good afternoon again, Chair Jacob Hurlitz, Department of Taxation. Will stand on our written comments requesting a January 1, 2022 effective date. Thank you.
Thank you, Jacob. We also have Dean Nishina with the Division of Consumer Advocacy, DCCA, offering comments.
Good afternoon, Chair Johansson and members of the committee. We stand in our written testimony offering comments, but available for any questions. Thank you for the opportunity to testify.
Thank you. We also have Commissioner Griffin with the Hawaii Public Utilities Commission offering comments.
Hi, good afternoon, Chair, Vice Chair, committee members. My name is David Parsons. I'm here on behalf of Jay Griffin, Chair of the PUC. You have our written testimony offering comments. We'll stand on the testimony and available for any questions. Thank you.
Thank you, David. We also have the Hawaii Department of Agriculture offering comments. Phyllis Shimabukuro-Geyser.
Good afternoon, Chair Johansson. Morris Sata on behalf of the Department of Agriculture. The department stands on its written testimony and defers to the Department of Taxation and the Public Utilities Commission for specifics. But we want to note that we are in favor of anything that supports our farmers and ranchers. Thank you.
Thank you. We also have the Hawaii Farm Bureau, Brian Miyamoto, in support.
Good afternoon, Chair Johansson, Vice Chair Kitagawa, members of the committee. Brian Miyamoto here on behalf of the Hawaii Farm Bureau. Hawaii Farm Bureau stands on its written testimony and strong support. I just want to point out that measures like this in particular is going to support our neighbor island farmers who are at a slight disadvantage when it comes to transportation. So we ask and urge the committee to support this measure. Thank you.
Thank you. We also have the Tax Foundation of Hawaii, Tom Yamachika.
Thank you, Chair. Tom Yamachika from Tax Foundation. I rejoined the committee just in time. The comments that we have on this bill are kind of an indictment on taxing transportation generally. We think that given the position of our island state and the dependence that we have on transportation, as well as the fact that air transportation cannot be taxed because of federal preemption. I think we really should be looking at rethinking whether we want to tax inter-island transportation at all, and by whatever means. Again, due to our unique economics and geographical situation. I'd be happy to answer any questions.
Thank you very much. We also have Chris Nakagawa with Young Brothers offering comments.
Good afternoon, Chair, Vice Chair, and members of the committee. Chris Nakagawa on behalf of Young Brothers. We'll stand on the written comments and available for any questions that you may have. Thank you.
Thank you. We also have a David Veltri from Young Brothers offering comments, if you wanted to speak as well.
He's part of my staff, so we're the same. So thank you.
Thank you very much, Chris. Members, please note that that is the extent of our present testifiers. We also have 2 additional testimonies offered in support by organizations. Members, any questions on HB 1144?
Sure, I have one question.
Representative Tarnas, please.
Thank you very much, Mr. Chair. I wanted to ask a question of the PUC. If you could just briefly describe the Hawaii Water Carriers Working Group, and your testimony says that they'll be presenting their findings to the legislature prior to the 2022 session that specifically will address agricultural producers and this whole issue of transport and the cost. Is that correct?
Yeah, this is David Parsons on behalf of the PUC. Thanks for the question. Yes, that's correct. Pursuant to Senate Resolution 125, which passed last year, the Senate's requested the PUC to form this working group, which we have done. And the working group does include members of the legislature, the commission, Department of Agriculture, Young Brothers, other water carriers that are not regulated by the PUC, as well as many other stakeholders who are interested in these issues. The issue of agricultural products and the rates, sustainability of water carriers, the business in Hawaii is all part of the discussions that are ongoing. And pursuant to Senate Resolution 125, the commission will be or the working group itself will be submitting a report to the legislature prior to next session with any its findings and any recommendations, including any proposed legislation based on the discussions that they're having right now.
Thank you. So in fact, those recommendations should cover a lot of the issues that this measure is attempting to address.
Certainly for the part of this measure that is focused on discounts for certain customers, yes. I don't believe, I'm not aware that the working group is in discussions on the tax portion of this measure, but we're not testifying. We don't take any position on the tax portion of the bill.
Okay, thank you very much. Thank you, Mr. Chair.
Thank you, Representative. Members, any other questions on HB 1144? Okay, seeing none, we'll move on to our last agenda item, HB 1014. This is relating to authorizing the Department of Land and Natural Resources to lease pasture lands on the terms that promote collaborative beneficial use for forestry, wildlife, recreational, and food production purposes. That might be the winner for the longest bill title I've ever seen. This bill would authorize the Board of Land and Natural Resources to amend and extend existing pasture leases and to issue new pasture leases by negotiation in furtherance of those enumerated priorities. It gives DLNR priority to transfer to the land that was transferred per productive agricultural uses subject to certain conditions, and it requires a third-party advisory committee to be established before the disposition or transfer of any disputed lands. First off, we have the Department of Land and Natural Resources, either Ian Hirokawa or Russell Suji, offering comments.
Ian Hirokawa with DLNR Land Division. Good afternoon, Chair, members of the committee. Department will stand on its testimony offering comments. Thank you.
Thank you. We also have DOFA with DLNR, Irene Sprecher, offering comments.
Good afternoon, Chair, Vice Chair, members of the committee. Ian will be representing the department on this, but I'm available for any questions you might have regarding the bill or our comments. Thank you.
Thank you. We have the Hawaii Department of Agriculture offering comments.
Morrisata on behalf of the Department of Agriculture. The department will stand on its testimony offering comments. Thank you.
Thank you. We have the Hawaii Farm Bureau, Brian Miyamoto, offering comments.
Thank you, Chair, Vice Chair, members of the committee. The Hawaii Farm Bureau will stand on its written testimony offering comments on the winner of the longest bill title. Thank you for this opportunity to testify.
Next, we have the Hawaii Cattlemen's Council, Nicole Galais, offering comments.
Yes, Chair, Vice Chair, and members of the committee, Nicole Galassi testifying on behalf of the Hawaii Cattlemen's Council. We are just offering comments. We'd like to point out that there already is a mechanism for this, which is Act 90, 2003, and we prefer that, but we do offer comments on this, respectfully requesting amendments. Thank you.
Thank you. Members, that's the extent of our testifiers present for this measure HB 1014. Please note that we also have additional comments and opposition from various organizations. Members, any questions on HB 1014?
Sure, just one question.
Representative Tarnas, followed by Representative Onishi.
Thank you. Thank you, Mr. Chairman. For the Cattlemen's Council, in your testimony, you have requested some amendments. With these amendments to clearly specify food production is included as a public purpose responsibility of DLNR to promote ag values, and an ag appraiser would be used to set lease rents, including pasture lands, upon lease reopeners and upon negotiations, and that the board would set lease rents rather than the chair. With these amendments to it, is this bill something that you think would help to address this situation? Because it does give some additional lease authority to DLNR to have better lease terms with the ranchers?
Like I said, we do prefer Act 90 of 2003 for remedying this. But with those requested amendments, it's something we could consider. I would like to say that I believe it's something we would still need to get some legal help with, trying to find out if the terms that are stipulated in the bill are actually the same as what DOA would be able to give. So right now I wouldn't be able to say, yes, we'd support it, but we would consider it.
Thank you. Appreciate that.
Thank you.
Thank you, Representative. Representative Onishi.
Yes, for DLNR. Mr. Hirokawa, how would the department determine whether or not to utilize this provision and renegotiate these leases?
Well, I think if we would look at when a lease is nearing the end of its term, I think the idea behind the bill is we would be open to an additional direct lease or an extension of the term, but in that extension or new lease allow for some activities in regards to forest reserve management and watershed protection. And I would defer to DOFA to maybe elaborate on what maybe specifically they have in mind. But it would, I think the idea is we would like to, we would be okay or fine with seeing it continue in pasture use, but some, a little bit maybe with some balance of resource stewardship, forest resource stewardship.
So a current lessee, say within 10 years of their lease expiry, could request for an extension or renegotiation, and the department would be required to come up with a provision for that renegotiation or extension or new lease. Is that what you're envisioning?
That's my understanding, but I'll let Forestry comment on what specifically I think they would want to see.
Thank you, Ian and Rep. Onishi. Just to provide a little bit of clarification, what this bill proposes would allow the department a little bit more flexibility in addressing those lands that are used for agriculture that are under the department's stewardship. So it would be applicable just to those types of lands, those under pasture land use. And it would give the department additional flexibility similar to what the Department of Agriculture has for how they negotiate those leases. So yes, those would be some of the provisions that would be provided to the department that we don't currently have the ability to do.
So it would be the intent of the department to keep these lands in agricultural production?
Yes, we believe that there are a number of these areas under the department's stewardship that do benefit from agricultural production and can contribute to the state's agricultural diversification and sustainability goals, as well as providing for other natural and cultural resources. So they really are multi-resource lands that can be managed for those multiple uses, agricultural being an important part of that.
So in Act 90, the law requires that lands in agricultural production be transferred to the Department of Agriculture. Why has the department not executed on that law?
The department, and Ian, of course, can fill in here because he's a little bit closer or more familiar to this. The department has been processing lands under Act 90. We are just around 19,000 acres of agricultural lands that have been transferred to the Hawaii Department of Agriculture. We are currently processing some additional lands that are under review for consideration. So we're still working on Act 90. We admit it's taken some time to get through the inventory. I think we're getting close though. Ian, is there anything you would add?
Yeah, I would just maybe clarify with Act 90 though, just to clarify is that it's not necessarily a blanket transfer of all ag lands. Part of the law is, transferred pursuant to the agreement of both departments. So that doesn't, if there are some lands that DOA is, have some issues with accepting, we can't just unilaterally transfer it to them. Nor with on our side, if there are some lands that we necessarily, or maybe in ag production, we don't have other resource values we feel needs management by DLNR. We aren't agreeable to transferring, and that sort of mutual agreement is part of Act 90.
But this issue has been around for many, many years. and there hasn't been resolution. Correct?
Well,
I believe that there's some parcels that, the department is still interested in retaining. And so those lands are still under negotiation between us and the Department of Agriculture. But we have been able to transfer a substantial amount of lands to the Department of Agriculture and are still working on the act. I will recognize that it has taken a number of years to get where we are, though.
So how much land does the department currently manage in its inventory?
about 1.3 million acres, I believe.
And how much land is involved in pastoral leases?
I'm not too sure. I thought why am I thinking about 100,000? But I'm not too sure. I don't want to be quoted on that one. I'm not too certain. It's a significant amount.
Yeah, so the 100,000 is related to another bill that we were looking at that would is related to Act 90 that we recognized would target about 100,000 acres. That number might be a little bit less of active pasture leases under the department because that 100,000 included areas that are within the forest reserve system or other game management areas managed by the Division of Forestry and Wildlife or unencumbered lands. So it's a less than 100,000 acres.
So you don't have an actual amount of active pastoral lands or leases?
We do have that information. I don't have it handy. We could get it to you as a follow-up.
Okay, Chair, if I might.
Please proceed.
Yeah, the Cattlemen's Council. So Nicole.
Hi, Representative Onishi.
Do you have any idea how much land we're talking about in active pastoral leases?
No, actually, that's actually information we've been trying to get because getting that information would let us know exactly where we are with land transfers. Information we have been able to get is lands that have already been transferred, but we have not been able to get from DLNR a list of lands that should be considered. We understand that it's not a blanket transfer and both boards need to agree, but we're not sure what that inventory is.
Okay, so you haven't been able to get that information even from your lessees?
We know certain lessees, yes, but we don't know all the lessees because the Cattlemen's Council doesn't represent all ranchers. We do represent a large portion of ranchers, but not all the lessees.
So for those that you do represent, do you have a total of the amount of land we're talking about?
No, not for as far as members. I can't make that estimation, but I do know that on the Big Island there were about 100,000 acre 100,000 acres that we were looking at when we were just looking at Big Island because we did have a list of those leases.
Okay.
But we didn't have for the rest of the islands.
Okay, thank you. Final question for DLNR, Chair. So DLNR, you just heard the response from the Cattlemen's Association in regards to their inability to get information from the department on the amount of active pastoral leases. Why is that?
I'm not aware. I mean, I'm not aware of what if they've asked for anything, and if I would say we're in discussions with them right now regarding this bill, and if they make a request, we can do our best to find out what kind of information they're looking for.
Well, I know that they've asked a number of times over the course of a few years when we've been trying to pass a bill to force the department to execute on Act 90. So you're saying this is the first you've heard of this request?
Me personally, yes.
You personally?
Yes.
And would these requests come to you if it was requested?
Not to me personally, not necessarily, no.
Okay. Okay, thank you, Chair.
Thank you, Representative. Members, any additional questions on HB 1014? Okay, seeing none, then we will recess for decision making. Recess. Okay, reconvening our 2 p.m. Agenda of the Consumer Protection and Commerce Committee for decision-making. My thanks to all who testified today for good and robust discussions, as well as to our members for persevering with us through these many agendas and many CPC referrals. First off, we have HB 137 relating to liquor. The recommendation here would be to make conforming amendments to include any of this material also to conform Chapter 244D to make sure that the language is harmonized there. As the Department of Taxation mentioned, some of the same language exists in another chapter. So harmonizing that as well as including a effective date of January 1, 2050. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 137 with amendments. Chair and Vice Chair vote aye. Representative Aquino. Representative Har is excused. Representative Hashem. Representative Kong.
Aye.
Representative Mizuno. Representative Morikawa.
Aye.
Representative Onishi.
Aye.
Representative Tarnas.
Aye.
Representative Matsumoto.
Aye.
Chair, your recommendation is adopted.
Thank you, members. Next, we have HB 592 relating to utilities. The recommendation here is to move this measure unamended as is. Members, any comments or questions? Okay, seeing none. Thank you. Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 592 HD1 as is, noting the excused absence of Representative Har, who will be noted as absent for the rest of this agenda. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Next on HB 102 relating to sunscreens. I think this is an excellent discussion to be having and one that will need to continue. Noting the National Academy of Sciences study that has yet to be completed and will be completed by 2022. I think I am concerned about the potential removal of 60 to 64% of sunscreens that are on the shelf at present. You know, I think we definitely need to be sensitive to marine ecosystems, but I also want to give deference to the National Academy of Sciences and their study before we decide how to proceed specifically with respect to any bans. So I think Hawaii is still a leader because we banned oxybenzone and oxynoctate. So we will still retain our leader status, but I think we need to also be looking at just consumer options as well as some of the other factors that are involved in the degradation of marine ecosystems. So with that, the recommendation on HB 102 will be to defer this measure. HB 214 relating to emergency medical service. I found it very persuasive that we may end up inadvertently with passage of this bill be diluting some of the qualifications for those performing emergency medical services. In light of that, the recommendation will also be to defer HB 214. Next, HB 227 relating to health. On this, I would recommend just one simple amendment, which is to take up the Department of Health's amendment to replace and with or, so that there are multiple qualifying reasons as opposed to just they all have to be involved in an and situation. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 227 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Next, members, HB 485 relating to taxation. The recommendation here is to move this measure unamended as is. Members, any comments or questions? Okay, thank you. Seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 485 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Next, HB 718 relating to health. The recommendation is to move this measure as is, unamended. Members, any comments or questions? Okay, seeing none, Vice Chair.
The recommendation of the chair is to pass HB 718 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Next, HB 302 relating to advanced practice registered nurses. The recommendation is to move this measure also unamended as is. Members, any comments or questions?
I have one.
Vice Chair.
Thank you, Mr. Chair. First off, I'd just like to say thank you to all the nurses and APRNs for the work that you do, especially during the pandemic. With that being said, though, I do have some concerns about this measure, particularly about expanding scope of APRN in a piecemeal fashion, which seems to be what's potentially happening with the number of bills that we are dealing with APRN. So I'll be voting with reservations.
Thank you, Vice Chair. Members, any other comments or questions? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 302 HD1 as is. Are there any other reservations?
Reservations, Matsumoto.
Oh, Matsumoto reservations. Any other reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Next, members, HB 576 relating to healthcare. I'd like to pass this measure with several amendments with the prior concurrence of the Health and Human Services Chair, as well as my work with the introducer. On HB 576, I would recommend that we remove physician assistants and make this exclusive to APRNs, as that's the group most heavily lobbying for the ability to do this. Also, limiting the ability to perform aspiration abortions to the first trimester, which is included, I believe, in the Board of Nursing's testimony, but it does comport with other jurisdictions. Also, noting the Hawaii Medical Board and the Board of Nursing suggestions, would like to include the amendments noted in the Board of Nursing's testimonies, as well as clarifying amendments to their amendments. Basically what this would do, members, is create within Chapter 457 the authorities that we would have given them in this bill. So removing the permissions under Chapter 453 and moving it to 457. Yes. As well as clarifying that it only pertains to the ability to do aspiration abortions, and that an abortion shall mean an intentional termination of pregnancy of a non-viable fetus. In the Board of Nursing's testimony, the language is a little bit unclear and references an operation, which people might inadvertently confuse. So we're clearing up the language there, as there should be no ability to do operations. And I'm told APRNs do not want to be doing any operations, as well as other technical and non-substantive amendments. Members, any comments or questions on the recommendation? Vice Chair.
Thank you, Mr. Chair. Again, just thank you to all the APRNs, physicians assistants, for being important part of the healthcare profession. And thank you, Chair, for making these amendments. I appreciate them. My concerns with this bill do not stem from providing access to abortions by APRNs, but are related to how we go about addressing the issue of APRN and their scope in Hawaii. Over the past 12 years, the legislature has passed 22 laws related to the scope of APRNs, either clarifying or expanding. And this committee has already seen 3 bills now related to APRNs. So I have concerns just about the piecemealing fashion that we're doing this, and would like to see us have legislation that looks at APRN practice holistically and how we can utilize that to improve our healthcare here in Hawaii. So that's the reasons for my reservation. So I'll be voting with reservations on this bill.
Thank you, Vice Chair. I think those are some excellent points. Members, any other comments or questions? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 576 HD1 with amendments. Are there any other reservations? Okay, are there any no votes?
No vote, please.
Representative Kong and Representative Matsumoto. Chair, your recommendation is adopted.
Thank you. Next, members, we have HB 598 relating to tobacco products. My recommendation here, because I'd like to keep several vehicles moving with different titles to address tobacco, vaping, and smoking, with the concurrence of the transportation and health chairs. On HB 598, with the concurrence of the transportation chair, I'd like to amend this measure further by making it applicable to applications and renewals right now to catch everyone. Right now, I think DOTAX feels the wording is only initial applications as opposed to renewals. I'd also like to take the Attorney General's amendment specifying person or entity throughout, and I'd like to keep this vehicle moving for further discussion. Members, any comments or questions on the recommendation? Okay, thank you. Seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 598 HD1 with amendments. Are there any reservations? Any noes? Representative Kong, no. Chair, your recommendation is adopted.
Thank you. Next, members, on HB 476 relating to taxation, I did confirm and secure concurrence from the HHH Chair, Chair Yamane. I would like to make the following amendments to this bill to clarify more clearly, since DOTAX said there's some ambiguity, to clarify more clearly that the tax should be imposed on the wholesaler and it should be imposed upon every sale as opposed to just once. I think that was DOTAX's major questions on this bill, and since this is a taxation bill, my thanks to Chair Yamane for allowing me to make these amendments. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 476 HD1 with amendments. Are there any reservations? Representative Kong, reservations. Are there any others? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Next on HB 826 relating to electronic smoking devices. I certainly note the oppositional testimony on this bill. I would like to keep it moving because, as I mentioned during the hearing, the part of the bill that is most pressing to me is like an enforcement mechanism for products that are on the shelf that may be unsafe or should not be sold at all because they did not apply for the pre-market tobacco application. But right now, the state of Hawaii has no enforcement mechanism for that whatsoever. And if we're really trying to ensure product safety, we should have an enforcement mechanism. So, and I think it's fair to continue sort of the discussion on fines. In the committee report, I do want to note both that it's not meant to be an exorbitant fine, even though it's blanked out at present, but we should continue to have discussion on what the right amount should be. I also want to thank my committee for an excellent suggestion of noting in the committee report that, should this measure continue to advance, that there should also be discussion of, rather than levying the fine on the underage vapor, perhaps a fine should be levied on an adult who purchases it for the underage consumer. I think that's an excellent suggestion. Unfortunately, we don't have enough time to consider that to meet tomorrow's deadline, but I think that perhaps is where this bill should go. I do want to cure some of the AG's concerns. I do want to explicitly note that nothing in the bill is meant to interfere with them carrying out their mandated master settlement agreement related enforcement requirements. Let's see. Also, the intent is to provide additional resources to the Attorney General to carry out these new enforcement duties as explicated in this bill to protect public health on all nicotine-related products. After consulting the Finance Chair, I'll also be amending the funding section to include additional FTEs, blank FTEs, and blank funds. But I will note in the committee report that in my conversations with the Attorney General's office, they've requested 7 FTEs, and I'll put the funding level as a note in the committee report. And this should cure their concern about having to be spread too thin. Let's see. Members, with that, any comments or questions on the recommendation?
Sure.
Yes, Representative
You
Palm.
also mentioned this on penalties for those that sell to underage 21.
Yeah,
Was apparent?
I'm putting that in the committee report, but I'm not actually changing the language in the bill.
Correct.
Yes. Any other comments or questions, members? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 826 HD1 with amendments. Are there any reservations? Representative Conk, are there any noes? Chair, your recommendation is adopted.
Thank you. Next, members, HB 1243 relating to hemp. I think we've had a really good discussion here. I think further discussion is warranted on this measure. So for now, we're going to defer this measure. Next, HB 1144 relating to agriculture. Recommendation here would be to amend this bill to keep in the general excise tax exemption portion of the bill, but remove the section that requires the PUC to authorize preferential water carrier service rates by tariff for ratepayers that operate farms or ranches. Removing that section while we wait on the PUC's noted report in their testimony. Members, any comments or questions on the recommendation? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1144 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Next on HB 1014, relating to authorizing the Department of Land and Natural Resources to lease pasture lands on terms that promote collaborative beneficial use for forestry, wildlife, recreational, and food production purposes. The recommendation here is to just double check something real quick. My thanks to the Water and Land Chair for his advice and counsel on this and his prior concurrence. The recommendation on HB 1014 is to move this measure amended in the following ways: by removing section 2, adding the cattlemen's suggested amendments, as well as the Kapapala Ranches suggested amendment as well, which is compensating the rancher for loss of capital assets and improvements to the land. Members, any comments or questions on the recommendation?
Chair, just briefly.
Chair Tarnas,
Thank you very much. I appreciate your suggested amendments. I tried to address this intractable problem that we have right here in section 2. It obviously didn't work, so I'm comfortable with pulling that out. But thank you for incorporating the Cattlemen's Council's amendments and the amendments from Kapapala. And hopefully, we, as this bill moves forward, we can continue to work together to try to resolve this long-standing problem. So thank you, Chair. I'll be voting support.
Thank you, Chair. Members, any other comments or questions? Chair Onishi.
Thank you, Chair. And I'd like to add that I appreciate your amendments. I think this is a long-standing issue that really needs to be addressed for us to improve on our food production and the ability for Hawaii to sustain itself agriculturally. Thank you, Chair.
I agree. Thank you very much. Members, any other questions or comments? Okay, seeing none, Vice Chair for the vote, please.
The recommendation of the chair is to pass HB 1014 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Members, we will only have a short floor bill hearing tomorrow at 2 p.m. My apologies for having to schedule that, but with that, this 2 p.m. agenda of the Consumer Protection and Commerce Committee is adjourned. Thank you.